Ishan, hi. Sorry, could you please make me co-host? Ivana here.
Who wants to be made a co-host? Which ID should I do that for?
Okay, I am renaming myself. Ivana Zoom support will say.
Okay, so Ivana, should I make you alone the co-host?
Yeah, if you can make me co-host, because right now I can help and also tell the attendees how to use interpretation via messages. Thank you.
Okay. I have requested for the same, and they will make you the co-host.
Please, let's settle in so that the session can start. Yeah, all looking beautiful and handsome. Good to have you all. Good morning, and would like to welcome you all to the Merck Foundation Health Media Training for the 7th edition of Merck Foundation First Ladies Initiative Summit 2025. This is great to meet you all today, and we are all here to gather great information and insight through a very informative agenda planned for you all. The Health Foundation Health Media Training is part of Merck Foundation's More Than a Mother Community Awareness Program. As you all may be aware, it's been organized to emphasize the important role that the media plays to influence our society, to create a cultural shift with the aim to address sensitive social and health issues. Kindly note that this health media training is being streamed live on all our social media channels. Before we begin this informative section, I would like to encourage you all to apply for the Merck Foundation Awards 2025. We have media awards on 2 themes for the Merck Foundation Media Awards: to address social and health issues, and lifestyle awards to address issues like hypertension and diabetes. We also have the Fashion, Song, and Film Awards on these 2 teams. So please share the information with your friends, like your colleagues and family members who are musicians and fashion designers, so that they can also apply to the respective field that they belong. We also will be sharing with you the call for applications. We all have them on your table for those who, and we hope that all of you would apply. And for those who need translation support, we've shared the headset with you. Kindly connect to Zoom and follow there. You can connect to the Wi-Fi here. It's the Wi-Fi passwords are on your table. Now, to begin the day, we'll start with a video of Jacqueline Bonde. Jacqueline Bonde is a Kenyan lady whose hands were chopped off by her husband due to infertility issues. Now, do enjoy the video.
Wende, a 27-year-old young woman from a rural place called Masii in Machakos County, Kenya, tells us her sad story of having both hands chopped off, not by thieves, but by her own husband. Wende, a 27-year-old young woman from a rural place called Masii in Machakos County, Kenya, tells us her sad story of having both hands chopped off, not by thieves, but by her own husband, for failing to conceive, even though he was the one with a fertility problem.
Mandi ndio nilisikia akigonga mlango akiniambia, Jackie, nifungulie. Niliachana na chakula nilikuwa nakula, nikaamka nikaenda nikamfungulia. Kitambo nimfungulie ndio alinikata hii mkono. Nikaanguka hapo chini na akanifuruta, nikaenda nikaanguka huko chini. Kitambo nianguka huko chini alikuwa ananikata kichwa na mikono na uso, na akanidunga hapa na kisu na hiyo panga alikuwa nayo. Aliponichapa nilimuuliza, kwa nini Ngila unanichapa? Utaniua peke yako. Akanyamaza, akaniambia, leo ndiyo siku yako ya kuongea, hautaongea tena maishani.
Merck Foundation came to the aid of Jacqueline through the Merck More Than a Mother campaign. She was provided with a new home and a supermarket to enable her to earn a steady income and become independent. Like Jacqueline, there are many other women that suffer from infertility stigma. Merck Foundation works closely with partners to empower them to be heroines of More Than a Mother movement.
Infertility is not just a woman's thing. It takes the two of them to have a child. So many treatments could make it right. So join her. Together, yenyan mona da, join her. Together, yenyan mona da.
Jacqueline, I want to know that you are my sister. As long as I exist in this world, on earth, my faith is connected to you.
Yes.
So you have to understand this. You come back to me in anything, I will always be there for you, and my room is there.
Thank you. Now, this video sets the pace for all of us to appreciate that issues of fertility and infertility is not just a woman's problem, but a problem for both the man and the woman. Our next section, our first presentation for today, would be on infertility prevention, the link between infertility and infectious diseases, and also male infertility. Now, to take us through this presentation is Dr. Edem Hiaji. He is an obstetrician, gynecologist, fertility specialist, founder and CEO of Lister Hospital and Fertility Center, and the immediate past president of the Fertility Society of Ghana. Ladies and gentlemen, with a round of applause, let's welcome Dr. Edem Ahiaji.
Thank you. Thank you. Good morning, ladies and gentlemen. It's always a pleasure to be with Merck Foundation, particularly the media talk, because we value the media so much in this day and age of IT expansion. They are the people in charge, because whatever happens in Iran is seen everywhere in the world. Whatever happens in Dubai, Merck talk is already being streamed in your various countries. So it is a very, very important session where people understand. I find it so fascinating in that science is moving on very quickly and we are going to the nitty-gritty of infertility, but at the same time, you need to be able to keep it at the basic level to explain it to the common man to understand. Otherwise, you're heading nowhere. So we'll quickly start. Yep. So the link between infertility and infectious diseases and male infertility. Well, so the first thing we have to understand is how babies are made. Because if you don't, then you don't even appreciate what the problems can be. So basically, a woman would release an egg every month, usually 2 weeks from the beginning of the month. That will be picked up by the tubes, and then the sperm would have to be available at that time for just about 3 to 4 days. If you miss that time, then that month is gone. So the sperm fertilizes the egg. Where's the pointer? Okay. Yeah, the egg fertilizes the sperm in the end of the tube. And then once fertilization takes place, it starts dividing. By the 5th day, it's at the blastocyst stage, and then it implants. Then when you do a test, you can find beta HCG that will confirm that there is a pregnancy. Now, what is infertility? When this natural process doesn't happen after a year of unprotected regular intercourse, and for regular intercourse, we say 2 to 3 times in a week. If you do that and for a whole year, you're unable to get pregnant, then we start getting worried that you may be infertile. This can be primary, which is you've never been pregnant, or it can be secondary. You've been pregnant before, but now it's becoming difficult to be pregnant again. That first pregnancy could have ended up in the delivery of a baby or an abortion, miscarriage, but you've been pregnant confirmed before. What's the prevalence? How common is it? The data says UK about 6%, USA about 10%. Sub-Saharan Africa, where the majority of us come from, and Southeast Asia, about 20 to 30%. This is a similar percentage here. Now, what are the causes? The male are responsible for 40% of the time, purely male, 40% of the time, purely woman, 15% a bit of woman, bit of man, and 5% unexplained. Now, in the developing countries, female infertility may be caused by mainly these endometriosis, where you have lining of the womb outside the womb giving problems, anovulations like polycystic ovary, where eggs are not released when they have to be released, hyperprolactinemia, the hormone that controls breast milk production and ovulation being too high, premature ovarian failure, where somebody's eggs get finished much, much earlier than they should, and then cervical and then endometrial factors. But in the developing world, the high level of infertility is due largely to consequences of reproductive tract infections. These are commonly infections from sexually transmitted infections, infections after abortion, or even infections after delivery. When this happens, the tubes get blocked. So that simple first diagram I showed you does not happen because the woman releases eggs all right, but they never enter the tubes, and the sperms never meet the eggs to fertilize them. And how do we have proof of that? Because they tested the fluid in women who were getting pregnant easily and those who were infertile, and there was more infectious agents in the infertile women than the fertile ones. So when the infections happen, then you get adhesions blocking the tubes, making it difficult for that simple process to take place. Infections can be associated with unsafe abortions, which lead to tubal blockage. And it's amazing that when I started practicing obstetrics and gynae, and I'm taking a history, and I ask the client, what kind of contraception do you use? And they said, No, 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 no. Then as you go on, then you get somewhere to do, have you been pregnant before? Then they say, yes. How many times? Then they will make a sign maybe 3 or 4 times. So to them, having a termination is not as bad as having contraception, because in our part of the world, when you start using contraception, it's thought that you're bad. You want to start having sex. That's why you're having contraception. But if you quietly got pregnant and went and terminated it, they didn't consider that a major problem. Asherman syndrome is when you have that termination and it's done badly and this overscrape the lining of your womb, the womb linings get stuck together, and then you also have another problem with getting pregnant. Then when we go to the developing countries, very few people actually get the opportunity to go to a proper hospital with good facilities without sepsis, that's aseptic conditions. And so a lot still end up with the traditional birth attendants or in churches where non-sterile delivery procedures are practiced. For that matter, pelvic infection after delivery is quite high. Then, where facilities are not easily available, you remain in labor for a long time, obstructed. When that happens, you have a lot of examination by the nurse, by the midwife, the doctor to come in. All that is introducing infection until sometimes it's even takes too long that the head is stuck in the pelvis and blocks blood supply to the wall in front, which is your bladder, or to the wall behind, which is the rectum. So by the time you eventually deliver, or even if it's by cesarean, that tissue is dead and it doesn't take long, it falls off. And so you have a fistula, which is leaking of urine through the vagina or leaking of feces through the vagina. That is quite common in our part of the world. Then infections like tuberculosis and schistosomiasis may damage both the tubes and the endometrium. Also, the practice of female genital mutilation is usually associated with complications that lead to infertility. So, Merck wants to let you know that it is a problem that affects both men and women equally, and so you must share your treatment journey. You should both go to seek for help. Half of the time, it is due to the man. And the commonest infertility is one of the commonest conditions affecting people in their reproductive age. Get informed, support your wife, get tested. What's male infertility? This is the inability of a male to make a female pregnant, a fertile female pregnant, after a minimum of at least 1 year of regular unprotected intercourse. I've mentioned that already. And the common causes in the developed countries are hypogonadotropic hypogonadism, produced by tumors or functional failures in the pituitary and the hypothalamus. Okay, the production of sperms and eggs is controlled all the way from the hypothalamus to the pituitary, then to the testes or the ovaries. There are hormones that control all that. That's going to be in my next talk at 2 o'clock for the fertility session. So these would be the common complaints or the common causes of male infertility in the developed world. In the developing world, by contrast, sub-Saharan Africa, for instance, sexually transmitted diseases, especially gonorrhea and chlamydia, account for a significant proportion of cases. These infections cause chronic epididymitis and occlusion of the vas deferens, leading to low sperm count or no sperms at all. In the olden days, it was gonorrhea, which was the commonest cause of infertility. Normally, typically in the male, you would have a whitish, creamy discharge, which would come on its own and very painful to pass urine. In the female, they would have also a foul-smelling discharge with a lot of pain, fever, and all that. But chlamydia is probably the most common cause now. So in the male, when that infection is picked up through the urethra, it goes into the prostate and the epididymis and would block this vas difference. This is the tube that takes sperm from the testis all the way through the back of the bladder through the prostate for you to ejaculate. So once it's blocked, you may get other liquid coming from other glands, but then the sperm is prevented from entering the semen. Then mumps, which is pretty common during adolescence. When you get that, it's a virus. When you get that viral infection, sometimes it affects the testis as well. Mumps and orchitis together can lead to damage to the sperm production organs and lead to infertility. If you had previous hernia repair and it wasn't done properly, that tube can be caught. Sorry. Yeah. The vas difference can be caught within the surgery, what the hernia sac may contain that, and once it's cut in, you will be made infertile. But normally, you should have had bilateral hernia for that to happen because there are two of them from each testis, one from each testis. So if it's one side and it's cut in, you still have the chance of using the other one. Varicocele, which is like getting varicose veins within the scrotum, tends to cause accumulation of blood within the testis. That tends to raise the temperature around the testis and makes it unsuitable for sperm production. God, in his wisdom, knew that the testis needed a lower temperature to produce sperms properly. That is why it's been brought out of the body to hang outside. So anything that keeps your testis hot will reduce your sperm production. Then there's sexual dysfunction like premature ejaculation, anejaculation where sperms don't even come out, or infrequent sexual intercourse, or retrograde ejaculation. Sometimes people ejaculate, but instead of coming out of the penis, it goes into the bladder. So conditions like badly uncontrolled diabetes can also lead to retrograde ejaculation. And then erectile dysfunction where the sperm, but you can't get the hard on enough to be able to release it. So share the treatment journey, and in men, limit your alcohol intake, avoid drugs, stop smoking, and that would improve your fertility. Talking about temperature, those who have to be on the motorbike for greater part of the day, warming their testis much higher. Those who always want a hot bath. If you're having difficulty impregnating your wife, then maybe you should go for a cold shower. What is the societal impact? It's a major cause of marital disharmony in Africa, exposes women to ostracization, social discrimination, and physical violence, as we saw in the movie that preceded the presentation. India and South Africa, for that matter, infertility has significant negative social impact on the lives of the infertile couple, particularly women, with frequent experience of violence, divorce, social stigma, emotional stress, anxiety, depression, low self-esteem. In all parts of the world, it always puts the woman in low self-esteem. Prevention. What are the preventive measures? Now that we know how it can occur in men and women and what the causes are, then we can start to talk about preventing it. As indicated earlier, major cause is from pelvic infections. So it's better to prevent the infection than to let it happen before. Primary prevention consists of prevention of sexually transmitted infections, post-abortal infections, and post-delivery infections. So that needs education, and this is where the media comes in. Community education on behavioral change and modifications of sexual practices, effective contraception, including particularly barrier methods of contraception, is very important. It reduces the number of unwanted pregnancies, and therefore the infections post-abortal will reduce once contraceptives are taken on. Similarly, the provision of effective maternal care services will help to reduce puerperal infections. This is at governmental level, but the media, again, is there to talk about it. What about secondary prevention? This involves early recognition and aggressive treatment of sexually transmitted infections. So when you find that it's possible you have an infection, don't just go to some chemist or pharmacy and say, oh, I want antibiotic. They just give you something. You take it, it seems to have subsided a bit, but then it's not completely gone because they never really tested to find which organism was causing it. And so it then becomes a chronic infection, and that even has a higher chance of making you infertile. So yeah, go to a health facility, do not self-medicate. Then tertiary prevention, use of methods to mitigate the effects of infertility in couples include systematic counseling with conventional methods, where cause is not a problem, use of one of the newer methods, where infertility is irreversible, counsel couple to accept their fate and consider options of adoption or fostering. Okay, now, the tertiary area, that's before it starts affecting the couple to the extent of ostracization and all the other complications that come in. They need to be properly assessed to see if one of the newer methods of fertility treatment like IVF, etc., can help. There will be somebody taking you through those. And if it's not possible, then there's still adoption and there's still fostering. In many parts of the world now, and particularly Africa, with the advent of Merck support to bring advanced fertility treatment to the developing world, we are being able to manage most cases of infertility. Where the tube is blocked, you bypass the tube by doing an IVF. So you get the egg out, get the sperm, and it can still help. Once you form the baby and the womb is good, you can still get pregnant. So you look at all the possible ways, and if that doesn't work, there's still adoption. There are still many unwanted pregnancies that need a home. And so you can then counsel on those. Yes, so those are the options, which I'm sure someone will take you through. Control ovarian stimulation with timed intercourse, intrauterine insemination, in vitro, cytoplasmic, testicular sperm collection where the tube is blocked. You can still do that. Gamete donation, surrogacy, adoption. Public awareness and health education. Yes, infertility should not be a stigma. It can affect anybody, but besides the negative impact of HIV on the body's immunity, it can also affect the body's ability to produce the hormones that are required to fall pregnant and may also lead to early menopause. So as you look at the broad aspects of health, that is also important for infertility. Chlamydia and gonorrhea, I mentioned earlier. If untreated, these silent infections called pelvic diseases and lead to all those complications: chronic pelvic pain, ectopic, inability to fall pregnant. Practice safe sex, condoms, and then the other infections which can cause infections. Smoking, alcohol, drugs, all reduce your fertility. Remain healthy, eat balanced diets, because if you're too fat, it affects your hormones. If you're too thin, affects your hormones. Try and have a lifestyle that would keep you fit. Limit caffeine. Okay. What are the key take-home messages? Infertility is not a stigma. It affects both men and women equally. You saw the statistics at the beginning. 40% all women, 40% all men, 15 a mixture of both, 5 unexplained. Get informed. This is part of it we're doing now. Support your wife. Oh, okay. All right. Support your wife. It's a shared responsibility. Thank you. I think I've kept to the time. Try to make it quick because I enjoy the interactive part of this presentation more than just spewing out. So we have a few minutes that the media, anybody can ask any question on any aspect that is unclear to you. Okay, the first, all right, the mic will be passed around.
My name is Gisela. I came from Cabo Verde. Thank you very much for your presentation. In the numbers you show in the beginning, you say 5% are other causes. What kind of other causes?
Okay, the 5% was unexplained. Yeah. Unexplained means you've looked and looked, checked and tested, but are still unsure of exactly what it is. We take unexplained infertility as a big subject in our international conferences and try to split it down and find out exactly what it could be. Sometimes it is just because you didn't take time to check every detail, and so it remains unexplained to you. I believe some of it is still what we are going to find out because we don't know everything. So let's leave that for the next decade or century, and maybe the number will become 2%.
But are you doing new investigations, new discoveries? That was my first.
Oh, okay. Whether there are new discoveries. Well, if I can remember, probably 30 years ago, the unexplained was 15%. Then it became 10, and it's now 5. That's why I said maybe in a few decades, we may narrow it down to just 2%. Yeah.
Thank you so much. My name is Leon Lidigu. I'm a journalist from Kenya, the Daily Nation. Now, I have 2 questions. The first one is closely related to my colleagues. Looking at the unexplained, in my line of reporting, I've come across conditions like blasted ovum. I've come across things to do with lifestyle, like in my country right now, there's something I consider a pandemic called the P2 pandemic, where we have especially young ladies who are taking even P2s as much as 5 times a week, which is, experts told me it's really dangerous and affects their system. So I just wanted to know, number one, to what extent do we look at also the biological aspects of it? Because last year I did a story where a woman had miscarried 20 times consecutively. She would reach 7 months of pregnancy, she miscarries. It took one doctor, one OB/GYN who was very keen, to find out that later on that she had an incompetent cervix. And you see, by that time, even the husband will not understand it. So to what extent are we patient enough to actually look, especially doctors, because they are quick. I see most OB/GYNs in Kenya, they're quick to, rule it's this, they make money, they move on. They have KPIs to meet as well, according to the employers. So how patient are we to really understand as a continent and solve some of these issues one by one? Then secondly, talking of discoveries, this week, there was a very interesting discovery from Stockholm University, where researchers actually now of the view that the sperm race is actually a myth. The way we were taught that once the sperms are released, they race to fertilize the ova. In fact, they were, if I may just read an excerpt, they were saying it's not just about who swims the fastest, it's the egg that actually makes the final choice, chooses the sperm that will fertilize it. So does that also contribute? Because we have instances where people have tried getting their wives pregnant. For many times, nothing happens. But when she steps out, even for a minute, she comes back pregnant with twins. So could that be a motivating factor? Thank you.
Okay, thank you very much. Your first thing was blighted ovum. Okay, blighted ovum, the person got pregnant, but it didn't develop. That's a different issue. So blighted ovum is where you get pregnant, you see a sac on scan, but you don't see a baby inside. The development got arrested at some point. A lot of it is genetic. Okay. Now, the P2 pandemic, for instance, we know, I showed alcohol and certain drugs. They cause disruption of the hormonal control of the things required for optimum environment for pregnancy to take place. So, yes, definitely, lifestyle, if you do excesses of things, it will affect your fertility. Then, talking about the myth about the sperm, yes, there are so many aspects of it. First of all, the sperm has to reach there. And for anything to happen in the body, there's the need for an agent to attach to a receptor before that signal can be given for the thing to happen. So if you don't get a receptor, it would not work. So many sperms can get there, but the right sperm has to lock onto the right receptor. And once that happens, there's what we call an acrosome reaction. Something blocks the rest of them from being able to enter. Anytime you get polyspermia, for some reason, the reaction is not good, you will get an abnormal embryo, and that too would fail. So coming back to your history, that is why Merck Foundation, again, is helping with developing capacity building in our part of the world, where you have enough doctors who are doing the right things. Many more people will have a proper history taken, a proper examination, and then the right diagnosis made. That case of 20 miscarriages before getting to have the baby is sad. Suffice it to say, losing a pregnancy in the first trimester, first 3 months, the indications or the reasons for that are different from losing it in the second trimester, that's the third, fourth to the sixth month, which is where normally the cervical incompetence, you said, comes in before third trimester. So you must know what it is. And sometimes you can get a combination of factors. You overcome one, then another reason causes you to lose it in the next one. So you need to be very on top of your game and particular. And in fact, you need an aggressive doctor to succeed in such a case, because you take it for granted. Oh, she's now 2 months, she's now 3 months, oh, she's now, and before you realize, you've lost it again. So these cases are there, but there are many success stories like that. I can't begin to share those now. Sorry, I keep dropping the mic whilst people streaming would want to hear me better. So I think I've covered enough of your questions. If there are any more questions. Okay, all right.
Yeah. Good morning.
Morning.
Maki Mukhtar Jalo from Sierra Leone. You mentioned that 40% of this infertility came from men and then 40% from women. We have 15% from both angles. And the question is, what strategy can be implemented to ensure that both men and women are equally involved in infertility diagnosis, treatment, and education, especially in cultures where women are disproportionately blamed?
Okay, thank you very much. Well, this is all what MEC is about. More Than a Mother campaign, increasing capacity for health personnel to be able to be available to investigate and treat, and bringing on the media, because you know, when I started practicing obstetrics and gynae, I would go on the television to give talks, go to churches. I'm invited to churches to give talks, go to schools to give talks, all on educating the people. But I'm one single person. If we spread it and it becomes knowledge is power, a lot of people are there, they don't know. And so they don't even know what step to take. They're not even aware. But the more people get to know, then the dynamics change. A lot of things cultural today. You're not even doing half the things your parents did as cultural, because you're getting emancipated, you're getting more knowledgeable, you're becoming aware of things that weren't known before. There was a lot of wisdom in most traditional things that they said, but without explanation. Sometimes we now discover the explanation, and then you can see the wisdom in giving those myths or taboos or whatever. But at that time, that was what kept sanity in that society. But as you get to know more, then you are able to realize that, oh, they can be helped this way or that way or that way. So we need to educate people more. The more doctors there are who are knowledgeable about this, the more the information can spread around, and you get the multiplication effect of the information going around. Now also, there's a lot of information on the net. So you don't have to you don't have to struggle to go to some meeting or some conference somewhere in order to get this. When I started practicing infertility, I had to go to my international conferences to get my updates. What did COVID do? It widened the scope for in interaction. Like, she did an online program and boom, now have access to everything around the same way. I did some Zoom meetings this morning before coming here, all because of the access to the internet. The younger ones growing in school are getting this from start, and so the information will go around, it will dissipate, and I think once the media is also highlighting it in their interaction with society, we will get more and more we'll get more information. That's the question from the front here.
Ruben from Namibia. Thank you so much for taking us into this gynecological class. Mine was on the statistic there. You rightly said in developing countries we are around 5%, then sub-Saharan 20-30%. And you equally attributed the infection in developing country And when we were presenting on male infertility also, you mentioned of infection as a contributing factor. So what explains such a big difference between the developing and sub-Saharan Africa?
Okay.
Yeah.
I'll reiterate what you said. I was trying to get it back in the statistics, but when I was talking about the prevalence of infertility, the causes in the developed world and the developing world, when it came to the developing world, and I was giving the data, the cause from infections was much higher in the developing world than in the developed world. Yeah, and I think it's access to care, access to treatment. There's more coverage. There's in the developed world, there's a lot of insurance, medical coverage, whilst in our part of the world, very little coverage, and then you have to out of pocket to get that to get the care. And if you, like I said, it's cheaper for you to just walk to a chemist nearby and say, oh, I have this thing. What do you say? Oh, take this. It's one kind of antibiotic that does everything, they claim. In the meantime, they'll say, can I take a swab and give you something more potent? Maybe it's the third generation of what you are using there, which has a lot of resistance bacteria because it's been overused, but that's all is available there. So you don't get the treatment properly done. And because it's not properly treated, the next girl you take, you've passed it on to her. And then the next person also passes it on. So that is one of the reasons why it's more common. Then when you come to abortions, for instance, in these countries too, there are abortion services. In the UK, for instance, if two doctors can sign for you to have an abortion, you go to a proper place where it is done properly and you are covered with the right antibiotics and you have access to come back if there's anything. There you go, back door, they do it. There are things left in there for a long time. You can't get any help. It gets putrefied, infection is on, they give you this, it gets a little better. You even say, take some herbs, you take it, it does something. But at the end of the day, because it's not quickly treated, the tubes get infected and get blocked. So those are some of the reasons. And even with health delivery, delivery system, not health delivery, but birth, you don't just go anywhere and deliver. You go to a good place, even where, interestingly, home births are becoming a posh thing in the developed world now. They still do it with parameters which you must follow in order to minimize complications. Even whilst you accept the whole birth, there's an ambulance is in waiting. If they think it's going to be a problem, quickly you're taken off. By the time you get to the hospital, the theater is ready. So, we are at a disadvantage, but we must build up capacity ourselves and push our levels forward and let our people have a better tomorrow.
Dr. Adam, we have few questions from our online attendees also. And there is this woman named Catherine, who is a journalist in Malawi, is asking, they wanted to understand what happens when a couple fails to conceive infertile, but once they separate, can both have children with the new partners? What happened then?
Okay, yes. Similar to one of the questions here. Yeah, it is true. You see, when you look at the contributing factors, there is this 15% that is said is from both sides. So the woman may have a bit of egg issues, and the man may also have a bit of sperm issues. It compounds it. Sometimes, if it is mainly the man with low sperm count, and the woman also has some problem, that man with another woman with no egg counts may lift the level to a higher percentage. So if you have an old man with good sperms gets a younger woman with good eggs. Was it Zuma who had a kid at 80 to a 20-year-old girl? I think so, last year or so. That can happen, but that same man with an older woman may not happen because there is a problem with the egg side. Let's put it this way. We all know in the infertility place that the most important factor to success in managing any infertile couple is the age of the female partner. That again is looking a bit sexist, but that is the truth, because women have a shorter reproductive lifespan than men. Anyway, the subject is going to a different area, and I could keep talking for hours on that. Yeah, but that is it. You can get a man being a man with medium sperm quality, being what would I say, being covered by his wife who has very good eggs, and so he makes her fertile and doesn't know. In fact, to confess, it was after my 5th kid that I first did my sperm test. I just wanted to know, was it my wife who was bailing me out, or I actually had good enough sperms? Yeah, you never know. No couple who are having children ever go to go and investigate anything, because that is the expectation. It is only when it's not happening that you go to find out what is happening, and then you find the differences. So, Madam from Malawi, Catherine, yes, if the man is very fertile, he can make up for a bit of deficiency in the woman's side, and similarly, if the woman is more fertile, can also make up for a bit of the deficiency on the male side. So that can happen, that it never happens, and then when they go out, you find there's a difference. But more so often is the men. For some time now, I get men coming to the clinic to come and check themselves first, and invariably is because they had been married or with somebody and they let go of that person and they found that the person is now pregnant. So that is when they start to think, hey, could it be me? And then they now come back to check. But if you both went in the beginning, maybe you would have had help much earlier and not get to that stage. Yeah. Okay.
Okay.
Thank you.
Let's take this last question.
all
This
right.
is from one of our online attendee only, Fiona from Uganda. And her question is, I had a blighted ovum that required a DNC, which later caused blockage to my tubes. How can we ensure that we have safe procedure for dealing with a blighted ovum?
I'll talk to the Minister of Health in Uganda. Well, that's it. Things must be done properly. If you do a DNC and conditions that you're not sure, then you may be causing more harm than good. These days, for a blighted ovum, you may give medication to see if it can dilate the cervix, contract the uterus, and then it passes. But then you must also have facilities to follow up, because she may start bleeding in the middle of the night, and you need to be sure that there's a service that can clean out so she doesn't bleed excessively. And the follow-up must be there. Yeah. So putting systems in place is critical in getting the best of healthcare delivery. And so we should all work towards getting a better service from our leaders. So, Pami? Well, that's another story. Africa is so well endowed that we need leaders to help us to manage what we have so that we do not go with a bowl begging. Africa is where the next generation of wealth creation and all that is to come, but we need to sit down and manage our resources properly. That way would liberate ourselves from most of the situations we find ourselves: poor health, care delivery, bad roads, and all that. We've been endowed with a lot. Let's manage it well. Yeah. Any other questions? Okay.
Make it a last question, please.
Okay.
All right, thank you very much. My name is Alec Ponje from Malawi. I wanted to find out whether within Africa there are successful models which can be scaled up when it comes to fertility care, like countries which are doing quite well on that.
Well, I think South Africa, Northern Africa, Eastern Africa, West Africa, all have facilities that are coming up and doing quite well and doing a lot better. In Africa, I think the first IVF center was in Egypt, then South Africa, then Nigeria, and then the East and West also. Over the last decade, there's been lots and lots of good IVF facilities coming up, and you don't have to travel far because the standards are coming up very well. When I was helping to start the Society of Ghana, I think at the time we had like maybe 6 to 7, and this is talking about 8 years ago. Now we have more than 30 in Ghana alone. The standards may not be the same everywhere, but there are good centers around. I mean, and we have clients coming from all over. On a day I can get clients from Angola, Gabon, Sierra Leone, Liberia, and even from outside, particularly when it gets to looking for gametes. See, when you're in America and you're old and you have to get pregnant, but you need donated eggs. There aren't a lot of Black donors out there. Similarly in Europe, so you find that you come back to come and do that. And then, apart from that too, it's slightly cheaper back home than in the US and in Europe. So for some people who cannot afford it there, they will still come back home. It's a little cheaper and have a holiday as well. And apart from that, some things are not allowed in some places. Australia, for instance, may not allow surrogacy. But then there are a couple there, and the woman has lost her uterus because she had a problem during her first birth. So she has an ovaries, but they need somebody to carry, and they can't carry this. So they come back to Ghana, where surrogacy is allowed, and you can still do it. So for various reasons, there is medical tourism in Africa, and it's becoming bigger, and you can get services around, and you can get these services provided at affordable but excellent quality as going outside. And for the fact that we work with the international colleagues, so the standard is high. After I set up the Ghana, then together with Professor Oladapo and colleagues from South Africa and Egypt, we started the African Federation of Fertility Societies. I present at the International Federation Fertility Societies conferences. So, the standards are good. And with the support, we've started training fertility specialists in Ghana. The public sector doesn't have much in that respect. So my center, for instance, is a training center for fertility specialists. The standards are good enough, and so Africa is coming out. The Merck is helping so much with this, and I think even before I sit down, I still want you to give an applause for Merck Foundation for what they are doing for our continent.
Thank you, Dr. Adam, for sharing in-depth information with us. And for a key takeaway, fertility can be prevented and is a shared responsibility. Also, that infertility affects men and women equally. Dr. Adam will also be present after our session. So if you guys have questions, you can go and talk to him. So before we move on to the next session, we would like to screen our animation film More Than a Mother, which is created to raise awareness on infertility stigma and to break it. Please play the video.
In a land far away lives a man called David. David is married to Jane, his childhood love. David and Jane are wealthy due to their hard work. 2 years ago, David and Jane went out in their farm to work. They were saying lovely words to one another.
My love, Jane, I love you like I never loved before. You are so amazing. A virtuous woman indeed.
You're the best husband in the world, David.
A lady called Mama Bomboy and her son Chukudi passed by David and Jane's farm.
Judy, let's say a good hello to David and Jane. I think you know them, don't you?
Yes, I do, Mom.
I wonder how they can be happy like that when they can't have children. The woman is infertile. I need to let them know how miserable they should feel. Hello, lovebirds.
Hello, Mama Bomboy.
And then,
how can someone barren like you, Jane, pretend to be happy? You should be mourning and hiding your face.
Oh no, not again.
You should give your husband a child or else return to your parents. David doesn't deserve this. He is a kind man.
And Jane started crying.
Mama Bomboy, how can you be so cruel like that? What did we do to you?
Let's go, my boy.
Jane, my love, please don't cry. You know how much I love you. Don't mind anything she says.
She just said that I'm barren. You know, I also love children like every woman.
Don't think about what she said, and I don't mind having children.
David and Jane were happy once again. 1 week later, David's friend invited him for a meeting. On his way to the meeting, David was wondering what kind of business his friends wanted to discuss with him. He wondered if his friends wanted to buy all the yield he gets from his farm, or if they wanted to offer him some money to invest in his farming business. Finally, David arrived at the meeting place.
I see them in the corner. Hey, long time, my friends.
Hello, David.
What business do you have for me?
You see, David, you have been thinking. You know you are sad because your wife is infertile. Let's help you and find you a fertile young wife.
What?
Musa is right. We think you should leave that miserable woman you have as a wife.
Okay, now I see the kind of business you called me for. Let me tell you something. I can never leave my wife, infertile or not. I love her.
But David, not all women are barren.
Let's leave this discussion here.
The next morning, David decided to take his wife Jane to the hospital to seek some medical help.
Jane, my love, I promise to do everything for you to be treated.
Thank you, David.
At the hospital,
Hello.
Hello.
Doctor, I have brought my wife for the treatment. You think she is infertile?
That's okay, but you can't tell before we do the test. It might be you who has infertility.
What? Me? No way. A man is never infertile.
Men too can be infertile. Let's hope you two are just fine.
Let's hope.
after doing all required tests, it was David who had the problem that was causing the infertility. David had a low sperm count. The doctor told them that
Intrauterine insemination, IUI, procedure is required to be done.
David and Jane agreed to the procedure. The doctor told them
Many cases of infertility are treatable once they are diagnosed early. The following are major causes of infertility: poor nutrition, untreated sexually transmitted diseases such as chlamydia and gonorrhea, consequences of infections caused by practice of female genital mutilation, unsafe abortion, or unsafe delivery, the use of herbal doses and enemas which lead to pelvic infections and tubal blockage, exposure to smoking, leaded petrol, and other environmental pollutants.
David and Jane agreed to undergo the insemination IUI procedure. At the hospital, David waited patiently. The doctor placed David's sperm inside Jane's uterus to facilitate fertilization. Jane took a pregnancy test after 14 days and she was pregnant. 9 months after the intrauterine procedure.
Do you have a name for this little?
I think I'll name him David.
They both smiled and went on. It was time to go to the hospital to give birth. David and Jane were happy to finally have a baby.
I am happy now. I am a father.
No, David, you are more than a father. You were more than a father even before we had this baby, Ameche.
Yes, Jane, my love. You are also more than a mother. My friends, I have learned that infertility is not a curse. It's a condition that affects both men and women and can be treated and prevented. No one should be stigmatized because they are infertile.
I apologize for the bad words and foul mouth.
Now I have learned my lesson. What you are saying is right.
I am fruitful, beautiful, and endowed. I refuse.
Now we invite our second speaker for the session, Dr. David, consultant obstetrician, gynecologist, director of Women's Health and Fertility Specialized Clinic, Rwanda, and also our Merck Foundation alumni. Dr. David will highlight for us fertility management options, messages for the community. Dr. David, sir.
Thank you so much, audience. Good morning. Good afternoon, good morning, those following us online. I thank Merck Foundation for giving me such opportunity, to talk about infertility in our community. And while addressing the media, as a media, we have a great role to play in our society, especially in Africa. Africa, in Africa, when we face these issues of infertility, like as my colleague, my seniors have said, really Africa, the media, we have a very big role to play in regard to this, because in Africa, we face a lot of policymakers, be it in our ministries, they face challenges of, tropical disease, HIV, so many issues, poverty to handle in Africa, especially when it comes to our policymakers. So as a media, you have a great role to play to inform the community about infertility. And be it as a human being, we have the right to have babies. We have the right to have children. Every family has the right to have children. And in fact, we see in our region, everyone is born, get married, you have to get a kid. Though there are some couples that decide not to have a kid, but that's their right. But the first right, which even the Bible says, is that go and have children. That's the first thing they do. They tell us when we're in church. So this issue shouldn't be ignored. We thank Merck Foundation for really bringing up, this awareness and building our community. In our setting, if you don't have a child, development doesn't continue. Development, in our society, you see young men, women that get married, but because they don't have children, they can't own a land, they can't build plot together. Development doesn't incur. So we inform the policymaker, our governments, that please, the infertility is becoming an issue and shouldn't be ignored. It's be treated as as the other disease. It's not a luxury, so we must really respect and help. So here, the media, we have to play a big role, especially in Africa. In Africa, our society, they always believe in witchcraft. After marriage, even during the marriage ceremony, think that, oh, isn't it a witchcraft? Maybe we're doing giving us gifts. People think, because I'm now talking from my own experience when I'm treating patients. They come to my office, they say, oh, maybe they were bewitched. So you start thinking, these are thinking, it's not bewitched. They think maybe family wrangles, they don't like, we've seen all this. They come crying in our offices. But please, when we get opportunity, you as media group, to approach us in our consultation. For us doctors, we don't have time to inform the public. But if you're like, for example, you are in my setting and you're a media person, come to my office, ask me, what can I do to inform the public? I'll always give you all this information, and they'll be crucial to our community. Don't fear us in our consultation. Please come. You have a big role to play. So they also other the thing that is spiritual forces. And I think that, oh, maybe there are spiritual forces, things that we never respected before marriage. Please, as a media group, raise awareness. It's not spiritual forces. It's about the fact that our seniors have talked. It's about biology. There's so many factors we've had, infection. Others, they think there are some cultural taboos that I never respected. Maybe I changed the religion. Maybe my family was telling me I'm a Catholic, I changed it to be a Muslim. Maybe those are thinking that we should raise. It's not about culture taboos, please. That's why the media you have to come in and play big role. Others, they say it is God's will. They start to think, oh, maybe it's God's will, we shall have children. But please, as my fellow colleague says, women are time bound. Let's inform the public that women are time bound. Not every woman that goes into periods can conceive. No, not every woman can conceive. And if you see period, some women go to age of 50 and oh, I'm still seeing period. I'm 50. Maybe I'll give birth. No, please. Infertility is also time bound. Don't delay. Think about it. Don't say God is will. No, I see women at the age of 40s, they are coming to me that we are facing problem in fertility. They sit back. No, whatever you have, whatever assets you have as a family, you can have now a child. Don't think that infertility treatment is very expensive, because we see that in Africa, many couples, they have farms, cows, land. And now see, you have farms and cows, and you not bring this money to be utilized to have children. Now, what are those things you're keeping assets for? Do you think that infertility should be the last option to be thought of? No, please, infertility now, it goes with modernization. You can have a child, stop everything they have. Also, some partners, they think that they're incompatible. So please, I always hear couples, they come that, oh, maybe I have blood group A, you have blood group O, we are not compatible. So we shall not have children. Please let us inform the public. Getting a child is not about incompatibility. It's not about blood group. You can be a black, you can have children with the white, you can have any, because this is God creation. Please, let's break the stigma about incompatibility. Doesn't exist, please, the media. So another thing is that we have to talk about abortions. Sometimes you find that the community, once the couple they live together, they start to accuse each other. Maybe you had abortion, you had what? This is the cause of infertility. No, don't think about abortion. There are so many different lifestyles, as my senior said. You can. It's not that your wife had abortion that caused not conceive. No, there are so many things that you can tackle. It's you, the media, to address the issue. Don't think that you start backbiting each other. Maybe she had abortion. No, there are so many things that can bring about to deliver, not abortion. So the other thing is that the use of contraceptive. Some couples come in our settings and they say, "Oh, maybe my wife had contraceptives." No, it's not about contraceptives. It's about other causes that you have to understand. So please, media, help our community raise awareness, and our society will have proper development. Without a child, no development can happen. So much of the slides that I'm going to share with you, they have been talked about. We don't have to delay much on them. So the plan was this: to talk anatomy, physiology, the main cause of infertility, female causes, male causes. All these, my senior talked about them. I will not lay on them. You know anatomy, you understand. Maybe what I want to emphasize that the picture can talk more than the words. You find that most of the women, they come to our office and say, "Oh, maybe when we do sex, all the sperms come out." But what I want to assure you is that you don't need to you have to tell the community that when you have sex, of course, the semen, the ejaculate comes from the prostate gland. There's gland. So not all this that comes out has to go into into the woman's part. Within, there's some sperm that is made by testes that is only has to go to fertilize the woman's egg, because now the only sperm comes from here, and there's so much fluids that come from the glands. So another thing that others they tell you, "Oh, maybe there's some position you have to take when doing sex to ensure fertility." No, even someone who has been raped, it can, even if you ejaculate from even outside near the woman's vagina, you can get pregnant. It's just that there are some sperm that are here that move like as fish moves. So another thing is that this sperm, they need to move, and the water, the semen has to come out, and the sperm has to move. It's not that the man ejaculates that has to go inside. It's what some women do. That's why even when you do IUI, we remove the sperm and we leave out the water part. It's not that ejaculate that we push inside, no, because it's also dangerous and has some germs. So we talked about this. We don't have to lay on this, but what I want to emphasize is that we have to inform our society that after ejaculation, there are these sperms that they need to find a way to go and find the egg. It's not all the water that a man, and not every man that ejaculates that can make pregnant. Sometimes it can be content of water without these sperms. So we have to inform the society to know about that. So this is how fertilization takes place. We all know this. We have to inform our society that, please, we have to prevent infections that can hinder this passage. This passage have to be protected. With current situation, our young girls, they are going into sexual behaviors as early as possible. We have to inform as a media, the public, that all girls, if you prevent your passage to be virgin until marriage, it will lead into your protection. This Fiona from Uganda was asking that this Brighton ovum. Imagine if you get this Brighton ovum before marriage, and they are blocked, or unsafe abortion, you spoil your passage which God created. So stop any unwanted behaviors, especially sex before marriage or unsafe abortion, which will bring infection to this part, which is great. So I'll not say much about the causes. We know that there are many male causes and female causes. As media, we have to understand there's many male causes and many female causes. Please don't try to know that we have a culture in Africa that if a woman is not having children, I can have somewhere another one, like someone who was asking. But the cost of wanting to have a woman outside is higher than approaching us to help you in the cost. First of all, there's a cost which is really more costly to have a child, a woman outside, than having you bring your wife. We treat you, you get children, and everything as God planned, you have it. It's not costly these days. So, as my colleague said, they are female factor, they are unexplained, they are both. So please, as the media, let us really inform our public about this. Those in New Times, those in writing papers, please help us address these issues. So all this was talked about, infection, the treatment part. It's very difficult to you as media to understand the treatment part, but please approach us in every country where you are. Approach doctors to inform the public, and we shall get the ball moving and help our society. So we talked about this. In Africa, we have high rates of couple infertility, stigma. All these I talked about. I'll not lie about it. So, let us help each other. There are sometimes you may find a practitioner. Even, infertility treatment is about levels. As you see, the government has health centers, a hospital of referral, a tertiary institution. Even infertility, it can be helped on the community level. Like you, the media, you have a big role to play, and this big role can be utilized on the community level without even coming to the hospital, like lifestyle, everything. All these things you have to understand and help us. So we have levels of managing infertility before even before encroaching. We don't want to manage infertility at advanced ages. The more you advance in age, as my senior said, the more it becomes complicated, but because the eggs are aging. By the way, there's one thing I want to talk about is that, but you have to inform our communities. Like, we have now technologies. You can freeze your eggs. For example, you can be a young girl, a woman, you're still advancing your careers, and you're not yet found the right partner. Know that the technology, you can freeze the eggs. You can keep your eggs. Instead of coming to us at the age of 40, when you have had your right partner, that I want to get a children. Know that nowadays you can keep your eggs advance. You can keep your eggs, freeze them. Do you know that keeping your eggs in your body as you're aging, it hinders giving a child? So better inform the public that you can keep your eggs, freeze them, continue your career. Even if you come at the age of 50, we can give you back your children, your eggs, when they are okay, than advance your career, then come at the age of 40 that I want to have babies on my own. Then we tell you, please, your eggs are now old than that are older to your egg, because your eggs will be affected by the substance, by the how environment affects your eggs. These substances we've been hearing from our seniors, all this environment pollution. Your eggs are better kept somewhere than going with them. I had a colleague, a friend, who was married to, he was white, he was married to African guy. Now this African guy divorced this white lady, and the white lady said, "Oh, doctor, because I've been following them like for quite some time, a few days now. This guy, African guy, divorced this white man, white lady, sorry, and now this white lady is, oh, now my friend had divorced me because I've not conceived. Let me go to my home area. I freeze my egg. By the time I get the right partner, I use my egg. I said, oh my God, this lady, she's understanding. So also let's inform our couple, our community, that even if your husband divorces you because you're not having child, you can freeze your egg, and by the time you get your partner, you can utilize these eggs, please. So they shouldn't feel depressed, isolated because they are not helped. So please, thank you so much. I will talk you based on our experience. Let's help our community. Please, media, approach us, approach doctors. We shall give you much to inform the public, and we make our community develop. No family can develop without a child. You know this. So let not the policymakers, the government, ignore infertility, because even them, where they are in their cabinet ministry, they have children and they need children. So please let us move together, help the infertile couples. We know their burden. We know that. Thank you so much. Thank Merck Foundation for this issue and helping our community. We shall always go extra mile as you help us do the same. Thank you so much.
Thank you very much. Do you have any questions for him?
Hello, hello again. Thank you very much for your presentation and information you give us. Frozen eggs is very expensive. I want to know if in Rwanda do people have financial support from the government, from the state, to do it, because in Europe it's expensive. In Cabo Verde, we don't do that. We don't froze eggs. So there's any financial support to do that? Thank you.
Thank you so much. Actually, when we understand really infertility, we come to understand that these things are not expensive. Freezing eggs, I think, is expensive, varying from one institution to another. But in our country, freezing eggs, even neighborhood, it's not expensive quite really, because you find that the only thing that is very expensive is having to undergo those injections, because when you're going, before we freeze the egg, we have to give you some injections to have more than two. In a normal female, every month you can have 2 eggs or 1. So when we are going to freeze the eggs, we give you more injections, so that you can have like 10 eggs to get out to freeze them. But really, the only expensive thing is to buy those injections, and because storage we pay every month, you have to pay every year, per year. So really, some people think that is expensive, but when you approach us, we counsel you and you tell us in every contest. I believe if you go to your fertility clinic, approach them, they will tell you how much, and you can negotiate. By the way, if you have this plan of freezing eggs, it's not that you freeze them. Plan, have a year plan, have 2-year plan. See how you spend. One thing I've seen our society, they spend other things, more money in weddings, more money buying land, more money buying a car. If someone is taking a very expensive car and he wants the fertility treatment to be less than a car, what can you buy to have a child? Please look at, don't drive your expensive car and come to my office. You want the freezing to be at even not buying the 2 tires of your cars. I think we need to think about it. It's no longer expensive. Maybe my senior can tell you more.
I just want to support my young man. Yeah. Egg freezing is an investment. We invest for many reasons, but there's nothing as painful as you getting all that you want, you're ready to have a family, and they tell you, sorry, you don't have any eggs. We have to take somebody's eggs for you. The egg has a natural progression. As you grow, by the process of apoptosis, the egg starts becoming abnormal. The older you are, the more apoptosis, the more abnormal the eggs, the less viable eggs. Now, the eggs have two things they do. One is to provide estrogen, which will give the changes that will lead to a period every month. Then the component, the genetic component that can lead to fertilization to give reproduction or, maintaining your genetic line. They lose that aspect of genetic line well before they stop giving you periods. So when you see your auntie who is 42 and she's just had a baby, that's her fifth, and you're still doing your PhD, you know that I'm 39, so at least I have 3 years, my auntie. It's not the same for everybody, one. And then the more fertile would have started the reproduction earlier and still have that fertility capability, whilst you may not have that and you haven't even started. Recently, I had a group from the US that wanted to do some work with me, and they were checking the fees. And he thought the freezing cost was too cheap. I should increase it. Okay, put in dollars, probably $200 a year to keep your eggs frozen for 10 years or 20 years, possibility. As he said, why do you want to buy a new car when you still haven't had your first baby? And then you are prepared to spend thousands of pounds on that than get a guarantee that you still have your eggs. I was discussing with the fertility center in Abu Dhabi 2 days ago that it's good that this opportunity of being able to help people extend the fertility lines and all that, even when they're older, is good. But it's letting people become complacent. It's like, oh, I've frozen my eggs, so I can do whatever I want. When I'm ready, I can have it. So they miss opportunities along the way because it's like you can postpone things till later. But at least it's good to know that the options are there. And it's not an arm and a leg to freeze eggs. What we are rather worried about now is that across the world, there are millions of eggs which have been frozen, and the people do not know what to do with them again because they froze them as a guarantee for the future, but got pregnant, and so they don't need them. But unlike cash in the bank that you can decide you want to do, you can only use your egg to have your own children. We've given them opportunity to give it out to somebody because people are looking for donated eggs and they can't afford it. Or give it for research. Oh, no. It's especially if it's an embryo. No. It's my child. How can I let them destroy my child? But then when you were creating them, you were not thinking of what you would do if they didn't. Anyway, this topic can go on and on. Thank you for.
Thank you so much.
Yeah, we are taking this last question for this speaker, please.
Okay, thank you very much. My name is Vitu Saudax from Tanzania. As you have been explaining about the storing the eggs, I have come to a light that this is for expensive people. There are people from remote areas where
they can't afford even buying a bicycle. So even if they use this low expensive measurements to stop getting birth at the time, they always that come to realize that are different effects on their fertility. They become after days they can't get baby or what. So from Africa and the other area, remotely where people can't afford that expensive issue, what can they do to stop getting baby, and in order to the future they can get baby by using the safe methods?
Yeah, thank you so much. That's a very good question. You know, infertility is individualized treatment. So my colleague from Tanzania, even each in Africa, we have a very big role to play in Africa. We have to tell them that infertility is individualized treatment. So our fellow Africans who are in remote area, we have to inform them that there are so many causes of infertility. Not all infertility that can be treated by freezing eggs. Sometimes these poor colleagues from the village, they need to be taught among the causes. So we have to teach them about infection prevention, the unwanted behaviors in your community as early as possible, so that we can prevent them from undergoing those advanced treatment. Let them teach them how to avoid infection, how unsafe abortions, say that these things, how not to delay marriage, say that we can help them have children without getting complications of wanting to freeze the eggs. You understand? Let us come to our communities based. Let us prevent our community from having such advanced treatment for them. Prevention is better than cure. Let us do awareness before and prevent such expenses in our very remote areas. But one thing that those guys in the village, they have farms, by the way. They have farms that they don't want to sell, yet they have those people in the remote area, they have farms and farms, but they don't want to sell them to have children. It's our role as community awareness people to tell them those farms, please, they are worthy that treatment. Thank you.
Okay, no, there is one last question, please. And this is strictly the last question for this session.
Good morning, doctor. This is Trifina from Botswana Weekend Post.
Okay.
There are cases of faith or spirituality whereby a woman will be barren, or the couple will be barren maybe for 15 years, 20 years, and because of their belief, then they have a baby and they'll be saying that it's because of their belief. Have you come across those cases, and how have you dealt with them?
Coming across what?
The cases,
Yeah,
such cases.
Yes, I have cases, and I have there's a group of regions that they are friendly to me, and I will not mention them here online. They tend to delay marriage and they start to use contraceptives. I see them at their old age, but sometimes I don't want to interfere in their faith. But as community awareness group, we need to tell them through the media, and this message will come to them without confronting them individually, but we can tell the community and they come to understand, because when you confront these groups individually, you are biasing their region, but inform the community and they will understand indirectly. I see them, they love me, they come to my clinic. It's a group of region. I don't want to mention them in online, but inform the public and they will come to understand directly that eggs are limited by age. So, and in African setting, they know that conceiving, you can conceive as long as you get period. But let us inform the community that eggs are limited by the age. Though we men, for them, they can go ahead as maybe God creation, but also when men also delay, they have issues of sperm DNA fragmentation. As the sperms are getting old, there's DNA fragmentation, which is there, but not as much as women's eggs. Thank you.
Thank you very much, Dr. David, for that brilliant and insightful section. Dr. Haji said that the success of fertility issues mostly depend on a woman. And I'm sure that if you're a woman here, if it sank deep, you are thinking about it now. You would agree with me that fertility issues is linked to psychological issues. It has psychological impacts. So we are now coming to have a presentation on the influence of infertility stigma and other social issues like gender-based violence, child marriage, female genital mutilation on women and couples, the social and psychological impacts. To do that with us is Dr. Francesca Bulwaya. She is a consultant psychiatrist at Chinyama Hills Hospital, National Mental Health Coordinator, Zambia, and a Merck Foundation alumni. She will also speak on how the media can create a sense of community sympathy and how to write inspiring stories on infertility stigma, linking it with the social and psychological impacts. Good to have you, Doc.
Thank you so much. Good afternoon. We've been seated for some time. Do we want to first stand up and just do a little bit of a stretch? Uh, in mental health, we're always conscious about well-being. So we can stretch. It always makes a difference. Stretch the other side. You can close your eyes for a few seconds. Breathe in, a deep breath. Breathe out through your mouth. Breathe in again. I open my eyes and most eyes are open. All right, again, can do it again. Awesome. We can take a sit. How do we feel? There's a level of grounding, right? Even just in those few seconds, the importance of mental well-being. Yeah, and I know the things that we're discussing are very reflective, right? And quite heavy. We should agree. All right, so we'll go right straight into it. Allow me to skip some slides that have already been alluded to. But you know, in presentation, you always tell a story, right? You are the experts at it. So, of course, when I was making my presentation, I started the story. But from the previous presenters, we've seen that most of the story has already been told. So I will not bore you with that part. And I'll try and take it to the slides that are speaking specifically to what I'm sharing today. Next slide. Oh, where's the... Oh, this one? Is this the one? Okay. Oh, I think I'm going in the opposite direction. Great. Awesome. All right. So I think you're now mini experts at infertility for today, right? What infertility is, its prevalence. I think those discussions have already been done. And I think for me on this slide, what I would like to emphasize is accessing fertility care, we should agree, is a challenge currently for us in Africa, right? And the Mediterranean region, and due to various reasons, and stigma being one of those major factors has already been highlighted. And that speaks to many aspects, our culture, religious, traditional influences, and for you as the media, I'm sure you are well vested in understanding contextualizing communication, contextualizing various issues or challenges that different communities face. So I think most of the statistics have already been shared as well. But I think one statistic that I feel that can simplify things and make us think is 1 in 6 individuals experience infertility in their lives. So just in this room, if we count 1, 2, 3, 4, 5, 6, amongst those 6, an individual may have experienced or will experience infertility at some point in their life. And that's a significant number. Me and technology. Okay, great. So just looking at this image, right? If we pay attention, where is the darker shade of pink? Just a millisecond, a few seconds look at this image, we already guide where the burden is. I know there's this misconception that in Africa people are fertile, or in the Mediterranean region people are fertile, or the Asian region, right? These are the understandings that we have, but statistics are showing the opposite. So are we understanding fertility in our context? And I think that's where a lot of these misconceptions come, where women won't seek support and will probably give other reasons for their lack of fertility. Because our belief in these regions is that we are very fertile. So understanding the population, its context, I will not go into this. I think Dr. Adam did a good job giving the various factors that cause infertility. Why is infertility important? Why is it important? Because firstly, it's a human right. It's a natural expectation that most people would have, right? To reproduce. And other than that, of course, nowadays there are certain individuals in other cultures who are now choosing not to reproduce for various reasons. Again, they have the right to that. But in general, globally, it's understood that most individuals will actually want to produce, and that should be a right of every individual. And that's why we're speaking about this. Then it will mitigate gender inequalities, especially amongst the women. We saw the video and we saw the impact on that woman's life. And there are many other such stories of women who've experienced a lot of trauma because of their fertility journey. And it has also caused a lot of disruptions in homes, in families, and in the community at large. Hence, we need to talk about this. Divorces, mood disorders amongst women, amongst children, in families, disruption of families. This topic is important. Then allow me to also speak about other associated factors to infertility. Gender-based violence. 1 in 3 women is experiencing gender-based violence. And sometimes we feel like, I think we've spoken a lot around this issue. So I think a lot of women are getting help, a lot of women are getting support, a lot of women are reaching out. Oh, nowadays, even men, by the way, as much as we are emphasizing on women today, right? But the reality on the ground is that many women are still not seeking support. Many women are still struggling in silence. Even educated, exposed, that's not even a distinguishing factor. So what more can we do? What role does media have to help more women to seek support, to help more women to speak out? Because it still remains a major barrier. And when we talk about gender-based violence, a lot of it that is usually highlighted is the sexual violence. But is it only sexual violence? There's more to it, right? And let's be deliberate to report around all the other aspects. A lot of it is sexual harm, physical harm that's reported, where there are issues of rape or sexual violence or child marriages. There are also various issues of physical punishment or domestic violence. But how many of us are talking about genital mutilation? It's a taboo to talk about it, right? But is it for the media? What role does the media have concerning such conversations? Mental harm, verbal abuse, emotional abuse. Are we being deliberate to highlight that as well in the conversations that we're having on the various media platforms? Economic harm, manipulation. Various economic studies that have been done, and they show that a lot of the breadwinners in these homes in the African and Asian community, you might find that it's actually women who are sustaining these homes. Is there an aspect of abuse there? Manipulation from the other gender? I know it's usually understood that it's women who abuse men, right? For their money. And men who complain. I see the men smiling in the room. So can we have conversations around those? And a lot of this violence is with intimate partner violence. And that's what complicates it, right? There's so many emotions, there's so many attachments. How do we guide people to navigate those complexities? In practice, what I've noticed, you report, you attend to this person, you give them knowledge, you start the journey of allowing them to get support or get alternative approaches to the situation that they're having, they disappear. Well, that process is just halted suddenly. What are those factors? Are we deliberate to research those factors in our different communities and highlight them and speak to better approaches or support that could help these communities? Or are we reporting as usual? What we saw people report in a different context, we also just replicate. Because I'm sure, especially in certain regions, like I know in the African region, there's a lot of training, there's a lot of support for GBV, right? But you'll find some of it is not contextualized. Maybe the material is westernized, which is okay, which is good. But are we being deliberate to adapt that information so that we can communicate in our various localities appropriately and in context? And when we talk about violence, it doesn't only affect women physically, emotionally, psychologically, socially as well. For others, they're beaten so physically, they won't be able to go work or go do their business, which affects their income to their home. And mentally, another aspect which is usually neglected. How is she doing emotionally? Has anxiety crept in? Has depression crept in? How is she coping? Is she struggling? A lot of times those aspects will be ignored. Let us emphasize those aspects of this presentation because these are actually preventable aspects. What guidance can we give these women or men? When it happens the first time, what do you do to avoid the chances of another one? What support can they get as a couple if that is going on? Or in a family setup, if it's maybe guardian to children? How are we deliberate about offering solutions to support services as the major house? I know these are some things that you actually know. My role here is just to remind you, to bring you back to that reflection, to allow you to be conscious again of this and make commitments to deliberately prioritize these communications. Another aspect that I'll touch on, child marriages. Because all these have an impact towards infertility, right? Have we seen stories whereby someone is physically beaten, that they have injuries even to their reproductive organs? It affects their fertility. Someone is significantly mentally ill, depressed. Are you expecting this woman to be fertile and apply herself or her body? No. So all these are connected. Child marriages, one would say. Let's look at the global map. You see the darker shades are indicating the intensity. What do we see in our region? Why are we talking about child marriages? It's quite high, right? Very, very high. Why are we talking about child marriages? Yes, it violates the right of this child or this woman. But again, it brings in other risks that we've been talking about in relation to infertility. Early pregnancies that may have poor outcomes, affecting their fertility along the line, or miscarriages or pregnancies that will be terminated, maybe not in the best way, affecting their fertility in the future, and also a risk of infection, various STIs at an early age and early exposure, affecting their fertility journey as well. All these aspects are coming together. And it's actually a high cause of mortality among young women in sub-Saharan Africa. So we need to talk about this. Then allow me to also touch on genital mutilation. Do we think genital mutilation has got any medical purpose? No. Thank you. I like that response of no. Others I noticed had a blank face in the crowd. It has got no medical purpose. Of course, there are various reasons why different communities practice it due to various traditional cultures or expectations or myths. Let us curb this activity. And a lot of them are not done in an appropriate setup, right? Because it's got no medical reason. So why would someone come to the health facility and the medical personnel start conducting such a procedure? Increasing issues of risk, infection risk, bringing back to those issues of infertility. And it is predicted that by 2015 and 2030, about 68 million girls would have experienced female genital mutilation. That's a significant number. What can we do about this as media? I was surprised the first time when I had to present on this. It's not something I'd even really paid attention to. I think I'd probably followed a YouTube video on it once, but I overlooked it and I just thought, I'm like, oh, probably it's just a small group in Africa that practices it. Then when I had to present on it and I had to read and research around it, I was amazed. I'm like, wow, that's the depth of the burden of female genital mutilation. It needs our attention. And it goes against the rights of these women and girls. Again, I like bringing images and pictures. I feel there's something that it does, even to our memory, to our understanding. Again, what are we seeing in this picture? Are we seeing the burden? Are we seeing the distribution? Those are significant numbers, even going as high as 90 to 99%. Are we speaking about it? So what's the social and psychological impact of these various presentations? I'll start with infertility. These women experience a lot of stigma, a lot of stress, a lot of pressure because of their infertility. As much as the experts have already shared that infertility is not only caused by women, it's both men and women, and it's actually equal. But how is that communicated or looked at in our various societies or community? Usually it's thrown on the women. And that's why today we're emphasizing and talking about the woman, but still highlighting the role of the man in this journey. Firstly, the pressure and stress that these women face is at individual level. Their self-esteem is affected, their confidence, their value of themselves. Before we even go to community, right? Because this is someone who's been being brought up in a certain community, which there are certain expectations that she should achieve, especially if that individual gets married, right? So that pressure, that stress first is individual and internal. Now, coupled with the external pressure of the community around them. And sometimes it's not just family, even random people in community. We saw the video, right? It wasn't even family, just a random person. So when are you getting married? When are you getting pregnant? For how long have you been married now? How come you don't have a child? You don't want a child. Inappropriate conversations, huh? I'm sure we see it around ourselves. What's our role as media? What can we do to sensitize the public on how to approach women or individuals or couples who are actually experiencing infertility? We need to educate our communities. Aunties, mothers, there are alternative ways that people can approach these individuals. So you find that these women experience a lot of stress, which leads to a lot of mental health challenges, a lot of them presenting with depression, anxiety, which further increases their risk of infertility. through various modes, right? When the body is stressed, I'm sure you heard Dr. Edim explaining, it starts where? In the brain. Neurotransmitters, it's like the body is connected. So when this woman is highly stressed, the hormones up there, they dysregulate. This woman is depressed, she's not eating, she loses so much weight. Again, dysregulates, making the chance of fertility even worse. So let's have a holistic view or approach to this infertility conversation. So I think I spoke about others feeling like they're failure and even feeling embarrassed to actually seek support, right? Or to go to centers where they could get this support. Others will do it. They'll try to hide when they're trying to get this support. How do we normalize conversation of these services? What can we do as media? Maybe let me take a minute and hear from you. What do we feel are solutions to these conversations? Okay, I'll allow you to reflect and I'll continue, then we'll come back to the Q&A. And in addition, I was glad to hear earlier on that the angle that was shared, right, about investing in their fertility. Of course, it comes at a cost because it's an investment, but that as well in itself causes stress to these women. Even just the process causes a lot of anxiety, the different steps, medications that they have to get, expectations through the journey. I hope it works. Oh, I've invested so much. Oh, I'm trying this maybe for the second time or third time. Can we normalize conversations around this so that the public can understand the burden of infertility and they can be empathetic to individuals who are walking this journey? Conversations maybe like surrogacy maybe are not even accepted in certain cultures. So again, contextualizing our conversation to our various contexts. Then what are the psychological impacts for child marriages? Firstly, these children are not mature enough to handle the burden of parenting another child. So the psychological stress is too much for them, beyond which they can bear. So let's spare them that. And also the aspect of early pregnancies and HIV infections, which later on affect their fertility journey. I was just speaking to one of the fertility experts yesterday, and in that conversation, something that he mentioned was that an interesting pattern that we're seeing is that some women who had a child earlier, years ago, then suddenly after some years, when they choose to produce again, for some reason they're experiencing some complexities. I haven't yet taken time to read the science around it, but it could be also related to the same. Early pregnancies with various complications in between, then when they're now mature, stable to manage it, they find themselves in complications. So what's the role of media? Do you believe you've got a major role in this? So what are you doing with this privilege that you have about this conversation? The media right now is so powerful that even myself, sometimes I stay away from the media to avoid its influence. You've got that much influence. What are we doing with it? Initially, I used to wonder, I'm like, Merck Foundation seems to invest so much in the media team, because I'm not much of a media person myself. But with time, I'm starting to appreciate the role that media has, the power that you have, and how can you use it to achieve this goal. So a major important aspect is awareness, educating the public. Speak about it, social media, TV, radio, in-person physical engagements. Let us make the public understand what infertility is, what can cause infertility in simple language, right? Why should they care about infertility? How can they look out for infertility? When does something seem normal and when does it become infertility? When can they seek help? Then very important as well, where can they get these services? Where can they be assessed? For me, I think a program where these things are actually being outlined. Yes, it might be a taboo or a difficult conversation in community, but who can normalize this conversation? You, the media, right? Advocacy. That's another issue or platform or approach that can be emphasized through media. Example, access to infertility services. Are you aware of how many insurance services actually cover the number of investigations or support that individuals need for infertility? Actually, very few. A number of insurance organizations or companies will not cover that. Are we advocating for such changes in policies? Are we creating platforms for such discussions? Why not? Oh no, it's expensive and various reasons. Like, but it is an illness as well, right? And that's why we're discussing it here. It's a condition. It's got a diagnosis in the medical diagnosis criteria, right? And that's why it's treated, and that's why it's got a treatment. Are we normalizing such conversations? And I think that's the power that media has. And it doesn't even have to remain just within our regions. This is even a global conversation, because a number of these insurances are actually global insurance platforms, right? Can we start such movements? So that a woman who is struggling, the more reason why insurance should cover it, right? Because it's costly. Just some food for thought, just one area. Lobbying for health policies that support infertility treatment or support or follow-up or care. So very important as well, even as we create this awareness, this education, let it be accurate. Engage professionals. I know you are very good at your job and you do a good work of research, though sometimes the public bring out certain questions or aspects which can be helpful to have an expert as you disseminate this knowledge, right? For maybe the accuracy of certain detailed information. Or even in preparation for your media presentation, you sit with an expert, you have a discussion, several questions and clarifications around their presentation. And also public engagement within those programs as well can be helpful. How, even when we talk about the topic, how do we bring it out? Because again, I know sometimes people say, oh no, even negative media has its role, but for such a sensitive topic, are we sure we want negative media towards it? What words do we use? What angle do we choose when we want to talk about this topic? The angle we choose or the approach we use, is it improving people's perception towards infertility to gain sympathy and support? Or is it adding to the negative view and stigma towards infertility? Those are some of the things that we should keep in the back of our minds. Then, having information that is detailed, even with reference and support services attached to that. It's not enough to just inform people, yes, this is this, it's a problem, if you identify it. After that, what do they do? What next step do they take? I like to use this picture. I use it several times because it amazes me on what just an image can do when we're talking about communication or approach of communication. When you look at this image, how does it make you feel? Does it give you positive vibes or negative, negative vibes, right? Negative vibes, dark. And when someone looks at it, when they think of infertility, would they think of something good or helpful? Could this help to reduce stigma, or it could possibly add to the stigma? It's those simple things. It's even in wording, huh? Dark, right? So it's such things whereby we can think, okay, we're using this to attract attention, but are we sure? Is it really achieving what we are trying to achieve? I'll give an example, even just selection of words. Yes, women with this problem who can't give birth. It's even selection of words, right? Okay, women who are on a journey of finding fertility. Are we seeing the difference? And sometimes even the stigma is in just the small things, but which make a big difference. Even for a woman who's listening to your program, for them to continue listening to you, if it's coming out strongly negative, judgmental, they'll immediately switch, right? Because remember, these are individuals who are already experiencing so much within them. But if they see that it's positive, it's solution oriented, supportive, empathetic, they'll now listen more to finish your program to actually get the knowledge that you're trying to put across. That's an important aspect I have noticed. And I think I've spoken on this slide. I tend to go ahead of myself. So media, you are powerful. You've got a great tool, you've got a great platform. Help us spread this journey in the correct and appropriate way. You're part of the solution. Think solution oriented. Are you being deliberate as media to highlight houses or families, support groups where women with such challenges meet to support each other or to guide each other, narrating successful stories of women, identifying such stories and such women sharing, anonymous, maybe places that people can be linked to for support or services, reference to experts on the program, right? On social media, a link. I think I've done my part. Thank you. Thank you for your
Do we have
attention.
any questions, please? We are taking only one question as we are running out of time, please.
Obrigado. Doutora Francisca, eu, em primeiro momento...
Sorry, just hold on.
Yeah.
I wish I knew Portuguese. That's Portuguese. But unfortunately, I'm not fluent in Portuguese. Maybe could I have a translator?
I will try.
Okay, all right, great.
I will try to translate.
Obrigado. Pois é, esta questão que eu vou aqui apresentar, ela está relacionada a uma outra que falaste há pouco sobre a mutilação genital. Eu falo concretamente da vasotomia.
He has some questions about vasectomy, you know.
Oh, okay,
okay. Is related with the mutilation genital too, but in men in Angola.
A vasotomia pode ser aqui uma forma de infertilidade provocada.
It's a way to provocate infertility in men, and
Isso é Angola.
in Angola, of course.
Porque nós tivemos uma situação social provocada por um religioso.
A religion in Angola provocate vasectomy in men's religion. Do you understand?
E o que aconteceu no meio aquilo foi no meio de pastores.
In church directors, in the church directors.
Os pastores arrependeram-se por terem feito.
They regret from doing the vasectomy because some of them have depression.
Isso não provocou apenas problemas psíquicos para os próprios pastores, como também influenciou as esposas.
It influenced their wives too because they did a vasectomy without the wives knowing.
Pergunto, como contornar esta situação para não causar efeitos sociais e psicológicos nefastos?
What to do not we have these mental issues when men do vasectomy.
como tornar o projeto mais que uma mãe impactante na vida das nossas comunidades tradicionais.
How to improve this More Than a Mother project in our traditional communities, rural communities. Yeah.
Sim, já a última. É verdade também, disseste aqui, que há pessoas, por vontade própria, não desejam ter filhos. Mas isto por razões exógenas. Mas olhando para as culturas locais.
Diz-me qual é a pergunta. Tens que dizer qual é a pergunta.
Não, eu já para fundamentar. Não é? Essa situação que é exógena, não é? Como é que ela... Eu falava de impacto, não é? Que a situação em si,
Ela não está... Ela não te entende. Mas...
sim,
Okay, we have the vasectomy issue. And também...
Sim, e da vontade de não ter filhos, não é
when someone decides not to have children from her own.
Não, é só isso.
Okay. It's in traditional communities when someone decide not having child, how to lead with that.
All right, thank you. Thank you. So I think I see two angles to the two questions. So the first one is around men and vasectomy and how the chances of reversing it are very low, and maybe they'll change their mind and they'll be depressed, or the time when they made that decision, they weren't in the right state of mind, and it has various influences like religious or traditional influences. I think for that, both ends, whether it's the men vasectomy or a woman exposing herself to situations or things that risk her fertility in the future, there's room for counseling. I think it's an important aspect in the fertility journey. And I believe even the fertility experts, that's why for me as a psychiatrist, I'm sure you're wondering, why have they brought a psychiatrist in this conversation, right? Because a big aspect of it is not only biological, there's the psychological aspect of it. And that's why I come into this conversation as a psychiatrist. These conversations should be had in the community. Behavioral change, right? So we're thinking of the behavioral change model, and it will take time, but it has to start somewhere. And it starts with conversations. It starts with conversations, reflective conversations, conversations that empower the public with knowledge, conversations that empower the public with an understanding of what services are available, like freezing the eggs, right? At first, before I used to think like it's a foreign concept, but we should make them realize why they should entertain that concept in our modern time, even in Africa or in the Asian region, despite our previous traditional beliefs. So that, okay, you're not sure today, maybe you want to do vasectomy, or do you want to freeze maybe the sperms as well? Okay, go ahead and do your vasectomy, but do you want to invest in freezing your sperms just in case you change your mind? Also, the woman, okay, yes, you're doing bilateral tubal ligation. We hear you. Today you feel like, ish, these pregnancies were difficult. I've had one, it's enough. In that moment, in those emotions, they might feel that way. But in the next 5 years, maybe they might feel differently. Okay, we hear you, we understand you. Could you consider maybe still freezing an egg as an option in case you change your mind? And even before individuals make such a decision, it shouldn't be one moment, one instant emotional decision. We take them through counseling before they actually make that final decision or that procedure is done. That's one. Then number two, I think the second angle or question is about, sorry, just remind me.
The second question about the women who decide.
No, yes, not to have children in our culture. Yes, yes, yes. And that's why we need to normalize these conversations. Because for some people will think like all the women who are not producing, they're infertile. Some women have just made up their mind, not even women. I also know men, African men. They've just said, no, for me, children is not for me. And those are the people now who you see individually going secretly, have their vasectomy, their partner doesn't know. Even women, a good number of women, they'll be on the pill or contraceptives, their partner doesn't know, or they've done a bilateral tubal ligation, their partner doesn't know. So it's encouraging the public to have these conversations, to be deliberate, to speak about these conversations, and also indicating that there is a choice. Because in other communities, it's not even just about having children. Maybe people expect them to have 4 or 5 children. They only want 1 or 2. Even 2 is a taboo in certain communities. Huh? So normalizing the conversation that it's a choice. How do we create healthy boundaries within the community around conversations of fertility? Thank you. There's a pressing hand.
Actually, we are running short on time. You can ask her question. She will be here only after our discussions. I'm sorry. Now, thank you, Dr. Francisca. It was indeed a great presentation. We will now take a quick lunch break. Kindly ensure you are that you will be settled by seats 1:45 p.m. Please, I know we are running out of time to be able to begin our session on time. Also, I request all the online attendees to join us by 2 p.m. We will be here joining our session at 2 p.m. again. Thank you. We are starting in 2 minutes, please. Okay. Good afternoon, all. Now, before moving on to the next speaker on diabetes and hypertension, I would like to share with you all that Merck Foundation has created 2 animation films, Sugar Free Jude and Mark's Pressure. The first animation films in Africa to raise awareness about diabetes, hypertension, and to promote healthy lifestyle. Through our new animation films, we want to encourage our communities to stop sugar, limit salt intake, exercise regularly, eat healthy, and never smoke. This is the only way to eradicate diabetes and hypertension, which are predominant risk factors for the development of several serious complications and heart diseases. Before we call our next speaker, we will shed some more light on this topic by this video of ours, our animation film created to promote a healthy lifestyle and raise awareness on the early detection and prevention of diabetes called Sugar Free Jude. Please play the
No more diabetes, reverse diabetes, goodbye.
It's morning rush time to school, and Jude is about to take a big bite into his breakfast on the go. Jude loves donuts, especially sugar-coated ones.
I love the taste of sugar on my donuts. It makes my morning sweet with this juice combination.
Jude, don't you think your eating habits are too unhealthy? I am worried about the rate at which you consume sugar products.
James, relax. I can't wait to eat my lunch. More donuts? There's nothing to worry about.
Jude was not bothered about James' concern. He went on eating more sweet foods day after day. As the days passed by, Jude started noticing something quite unusual.
My goodness, not again.
Jude would wake up several times at night to wee. It was so uncomfortable. Not only that, but he also noticed that he would wake up very thirsty. Jude would need to drink water multiple times during the day as well as night, and this also meant using the washroom several times.
Oh my God, this is so destructive and shameful.
What is it? This appears to be the third time you woke up to use the bathroom. You even look a bit fat. Very unusual.
I have no idea, Mom. And I've been feeling very thirsty lately as well. And sometimes tired.
We need to see the doctor to make sure all is well with you.
I agree, Mom. It disrupts my day at school too much.
At the clinic, Dr. Yobo decides to conduct a few tests to confirm his diagnosis about Jude. He opts to do a blood glucose test to check Jude's blood sugar level.
So, according to the results, you have type 2 diabetes.
Type 2 what?
Diabetes is a condition wherein the blood sugar level in your body becomes too high. In type 2 diabetes, there is insulin resistance or relative deficiency of insulin that results in excessive blood sugar, which in turn can lead to other health problems. In short, type 2 diabetes is a metabolic condition in which the body's insulin is either ineffective or relatively insufficient to deal with the blood glucose levels.
Dr. Yobo continued to explain to Jude about his condition.
The exact cause of diabetes is not known, but genetics, family history of diabetes, and an unhealthy lifestyle seem to be the most common and important causative factors.
What happens if diabetes is not well controlled?
The long-term complications of diabetes can include the following: stroke, blindness, heart disease, kidney failure, sexual dysfunction, and amputation. Type 2 diabetes is a chronic condition in which there is bodily resistance to the insulin produced by the pancreas, and it typically manifests in adolescents. Managing this will require medication and regular blood sugar tests as well as a healthy lifestyle.
It was tough to accept for Jude at the beginning.
My days of sugar-coated donuts and sweetened drinks are over.
But he had support for his new lifestyle. The school made sure his lunch was not full of the usual sweet things, and his friends reminded him to take his sugar test and play football or basketball with them regularly to keep healthy. His parents were also supportive, preparing healthy meals for him and removing all sweet and sugary drinks from the house. In fact, all family members became sugar-free too. Back in school, Jude and his friends soon formed a Sugar Police Kids Club to raise awareness about the condition and to help others who had diabetes or were pre-diabetic so they can prevent and early diagnose it.
Try to go sugar-free in your meals. Eat more fruits and veggies, along with moderate daily exercise. Our lives can be so sweet without sugar too. Let's all work together to fight diabetes every day.
Merck Foundation. No more diabetes. Reverse diabetes. Goodbye diabetes.
Now let us call our fourth speaker, Dr. Ruben. He's an executive board member and chairperson, Namibian Medical Society, senior medical superintendent, intermediate hospital Oshakati, Namibia, and also our Merck Foundation alumni. Dr. Ruben will be talking about promoting a healthy lifestyle and raising awareness about prevention and early detection of diabetes and hypertension. He will also highlight on how to report it to the community. Dr. Ruben, sir, please.
Afternoon, colleagues. Yeah. Research has shown that after lunch, most of the time presenters talk to themselves. I hope it's not the case. I brought you warm greetings from one of the oldest descent in the old Namib descent, and second largest canyon in the world also, the Fish River Canyon. And then the sentiment of our greetings from the Atlantic Ocean meeting the Namib Desert. So that is Namibia. So thank you, Merck Foundation, for this opportunity. My task, in the interest of time, actually have been done through the previous speaker of the morning sessions, who have touched on the most aspect that we are talking, and the animation that you have just played also covered my part of my presentation. Well, I assume the majority of the people here are media practitioners. And my role here is to join other colleagues who have presented before to see how we punctuate the role of the media practitioners in spreading the message about public health. It is really, undebatable that mass communication form a very important part of the implementation of health programs. And with my presentation, I will not dwell so much on the condition and pathogenesis, as I'm not talking to most of the clinicians here, but we want to tackle the last part there, how to report it to community. How do we bring in these very important stakeholders, that is the media practitioners, into reporting, since we are dealing with preventative and promotive medicine. So I want to underline three things: that the involvement of media will lead to three very important things. One is to get the correct information and timely information to the communities. Two, it will provoke change in attitude and values, health attitudes and health values. And then the last one, we want to cement and establish new health behavior with a view of sustaining such behavior for all. Yeah, sorry, it's not, I think it's not working.
Just one second.
Okay. Technology was also on lunch. Let's hold on a bit. Let me test. All right, we are good to go. Yeah, I think the animation that was played, they've already explained most of these things. We are talking of non-communicable disease, which are actual chronic condition not caused by infectious agents, or otherwise, in other words, they call it non-transmissible conditions. The examples are cardiovascular disease, diabetes, cancer, chronic respiratory diseases, and by statistic, globally, we have those type of diseases responsible for 74% of death. That's according to WHO in 2024. So these are risk factors as they were outlined in that previous play that we have seen: genetics, lifestyle, poor nutrition, tobacco, alcohol use, and other many things. And then we look specifically on diabetes mellitus, which is a chronic condition with blood sugars. There are two types, where you have type 1. It was already explained also that it's either you don't have enough insulin, or you have insulin, but then the body is not responding to that insulin. And then there is also diabetes during pregnancy. We know during pregnancy, there are a lot of physiological change that happen with a woman's body. And this includes also change in hormone. You find that change in hormone may lead to the body being resistant to the insulin, with the view that there is a second person who must benefit from the sugar. Then what are the symptoms? They also depicted there: frequent urinations, you are drinking a lot, you are urinating a lot, you have this, hunger, fatigue, blurred visions. Those are all symptoms. But what are the risk factors? Obesity, living a sedentary life, nutrition, we talked about eating unhealthy, the age, the genetic, very important, genetic predisposition. And those are some of the complications. And on prevention, it was also shown there: regular exercise, healthy diet, stay away from substance use as tobacco, alcohol, and maintain a normal weight. The second one that we are talking about from the NCADs is hypertension. Sometimes we call it a silent killer, which is defined by your blood pressure measured on 2 occasions, 2 different days, with the upper reading, which is a systolic of equal to more than 140, and the diastolic, which is a lower reading of 90, more than 90. So with this, it carries the risk of stroke, heart attack, kidney diseases. Often asymptomatic, it has some symptoms such as headache, dizziness, but the definite way to diagnose hypertensive is through measuring blood pressures and monitoring. What are the risk factors and how do we prevent them? Risk factor is, I don't know how many of you have taken enough salt during lunch. So extensive use of salt, stress, obesity, alcohol, genetic, we talked about that. On prevention, we need to monitor our BP, diet, exercise, reduce. And once you are diagnosed, you must, adhere and comply with the treatment plan and attend to your follow-up with your doctor. Now we come to the key question. I think why I'm here. The roles of media in community health education. This, I think the following presentation would delve too deep into that, but I should highlight 4 things. Is to disseminate accurate information, and I added there that on time, because this information can also be fertilized, just like undiagnosed hypertension. That's why I address misinformation and myths. I think you can relate from COVID-19 pandemic, what was happening there. Empower with prevention strategies as we discussed them earlier, and collaborate with the professionals. For you to report accurate information, you must get from the right source. The collaboration is very, very important. And you have heard from the area presenter, one of the colleagues said, sometimes they want to give more information, but they don't have time. So you are basically our bridge community and the healthcare workers, those who don't have time to go and pass on the message. What are the approaches that we need to employ for us to make sure your assistance is a quality one? First of all, you need to know your audience. I think there were lots of highlights on cultural aspect in the previous presentations. We need to contextualize cultural aspect into our planning, implementation, monitoring, and evaluation. We need to be cultural sensitive to our target communities, spiritual sensitive also to our target communities, such that we use the correct language, because it's of no point going to spread information in the language someone don't understand. Try to use visual and real stories. If you can relate with our fight against HIV/AIDS, we always have people, narrating real life stories. Comes to cancer, you always have cancer survivors, TB survivors who are narrating real stories, and it makes a difference in passing on our message. Promote peer educators and dialogues. Have community champions. Sometimes the message is not getting across because the people don't know you, the people don't trust you. But once you employ people from within their community, people that they spend time with, the people that they've grown up together with, you may realize that it's making quite a difference. And then you need to monitor communication outcome. In conclusion, diabetes and hypertensive are preventable. And I think there was also discussion around, a bit of health financing in the previous presentations. That no, we are not doing this as developing countries because of ABC, because of the cost, because of the accessibility. It is very expensive to focus on creative measures. That's why it's very important for us to put more effort on the promotion and the preventative measures of public health. And then we can win. Lifestyle change and reductions are key. And I think medias, we already given your flowers in the morning. I'm just adding another bunches of flowers that medias, our key partners, are in the public health programs. There is need to strengthen collaboration such that we give out accurate message, and then you go and represent and pass on the message to the targeted audience. So with that, let us be the change agents for the healthier communities. And I thank you so much.
Thank you very much, Dr. Ruben. Do you have any questions for him, please? Okay. Hello. Questions? Can you?
Thank you. Sometimes we heard about that Afro-descendants, you understand, have more ability to have hypertension. Is true that? You understand my question?
Are you saying African?
I'm
Eh-heh.
Afro-descendant.
I see. Yeah.
It's true.
Yeah, no, it's true.
Why?
Hypertensive also it's having a connection with specific ethnic groups or racial groups. And the research have shown in African, Asians, we are more prevent to hypertensive compared, but I didn't delve deep into it. But it's true.
It's because of the food,
It may be
lifestyle,
genetic predisposition. Yeah.
It's an interesting issue.
That we can investigate, like my colleague said in the morning, for the next generation. Yeah.
Hello, good afternoon. My name is Joan from Rwanda. So, some of these lifestyles, the risk factors of diabetes, they didn't just happen recently, yeah? They've been here before. But diabetes was mostly before known to be an illness for old people, but now it has changed. I don't have the specific statistics in Rwanda, but I've done some stories and it's common. Nowadays, it's common in young people. Why do you think it's so?
Maybe before, where specifically in which region are you referring to before I answer? Or it's globally?
Sorry, you mean the country?
Yeah. Or the region? Or it's in Rwanda?
Rwanda,
Okay.
yes.
Okay.
But is it different in other countries anyway?
No, thank you. You know, medicine is evolving and civilization also, especially in Africa. Before you may pick it up that it has been there, but it was not documented. Today you are doing research, but there was nobody who did research before, and there were no data that could justify that it was prevalent then. Probably today is more research, and the communities are more aware. We can talk of education level, the literacy rate is also going up. So all that are contributing to what you have found.
I just like to say, like my colleague from Rwanda, she said in Cabo Verde, younger people, we have each year more younger people with hypertension and diabetes too. Normally, in the past years, it's been increasing. Younger people being with diabetes and hypertension too. not only
Yeah, maybe just
older
to,
people.
on addition to what I have said, you find that there are also environmental factors that have changed. And nutrition that we mentioned is one of the risk factor here. Probably what you used to eat before and what you are currently, what we are exposed to now and what you used to be exposed to. All those, there are serious shift in those trends. Yeah.
Thank you. I'm Ambroisine Memede from Togo. And my question is to know which type of diabetes is more complicated. The second question is to know if there are any incompatibility between diabetes and hypertension in the case of care. And what can cause a sudden drop in blood sugar? Thank you.
No, thank you. I wouldn't say there's any diabetes which is better. They are all diseases, whether it's type 2, type 1. But I'm now talking from a clinical experience. I think type 1, we find it to be more challenging because you see it's diagnosed in children and young adult, though it can happen at any age. And here, that's where we are talking of insufficient insulin in the body, where you find that the treatment goes to where somebody is injecting themselves, and you can relate that to the young age in terms of compliance and adherence. So that, I think, bring in a bit of complexity with type 1 diabetes. But otherwise, all of them are looking at their complication. Since they can damage our nerves, they can damage our small vessels, leading to poor vision, kidney issues, tickling in our fingers and toes. So they are all bad, I should say. I didn't get exactly your second question on compatibility.
It says that there are some medicine which a diabetic, which is not compatible to a person who have both diabetic
Oh, I
and
see. Okay. Oh, in terms of management, yes, no, it's true, and that's why as medical practitioners, we take history, we assess, we prescribe treatment plan and monitor them to see what you are responding to, what you are not responding to. But you need to keep in mind that drug that we use to treat a condition have side effect and adverse effect. So we monitor to see if there are some of the side effect or adverse effect that are manifesting in any of our patients. And then we say, no, this one is suitable for you, this is not suitable for you. And what we find to be optimal, that is what we maintain you on a long term. In terms of blood sugar dropping, there are quite a lot of things that can influence a drop in blood sugar. One, we normally say it just like if you didn't have lunch, we start feeling some headache. What do you say? I think my sugar is going down. Basically, your body starts to eat up what was stored in the body, and your sugar starts to drop. Another thing is alcohol do drop blood sugar also. If you find somebody was nice intoxicated and you check them, you may find that the blood sugar goes down. level of consciousness drop, and so forth. But there are many other, can be chemical things that we have just ingested or inhaled, and quite a number of things that can cause a drop, a sudden drop in your blood sugar.
Good afternoon, Doctor. Jesse Ngoma from Zambia. Doctor, there seems to be some conflicting statements, particularly when you're talking about the diet for a diabetic patient. From my interaction with people that are diabetic, is there a standard menu for someone to take? Because we've seen some people even stopping to take some certain foods. Thank you.
Well, management of metabolic condition is a require a multidisciplinary approach where there can be a doctor, there can be a social worker or psychologist first to counsel that individual to accept the condition and understand it. And then there can be a nutritionist or dietitian. You find that nutritionists and dietitians, when it comes now to the menu that you're asking, they are more better than us. We advise, but they are more deep when it comes to specific food, because that's their area of expertise. Then they guide us, and they guide the patient also on what to take. But then you bring in the question of socio-economic status of a patient play a major role also. You advise me to take this type of food, but I can only afford to take this type of food. And that now make the equation very difficult to balance. And it's common in developing countries. Is you find that the patient is not adhering, not because they don't want to, but they have no means. So to answer your question, I wouldn't say there's a solid and unadjustable standard, but there are a number of certain foods that can be recommended. But in the end, it still is a question: are you having access to such type of foods to sustain the diet that you have been prescribed?
Last question. Okay.
This is the last question, please.
Thank you very much, Doc. Maki Mukhtar from Sierra Leone. The question which I want to ask is that why do so many individuals with access to information and healthcare still fails to manage or prevent type 2 diabetes effectively? But is it a mistrust in the medical system or what? Do you understand?
Why we have access to information?
Yeah.
And but still,
yes,
we fail to manage.
Yes, to manage. Is it a mistrust in the medical system?
All right. No, thank you. It's a human behavior. And I think that's what I have pointed out there, that we have three very important things that we need to do: give accurate information, okay, influence change in our attitudes and value, and the last, establish new health behavior. So, but if you find your resistance to change now here in terms of your health, is it ignorance or? Yeah, but still, you find that it's not really resistance to change always. The point that I have just mentioned, circumstance. of where we are living. Let's talk of stress. Stress can be in a workplace, can be in your life as a student, can be in your marriage. We mentioned of infertility in the morning. You see, these things are interlinked. There is infertility, there is marital disharmony, there is stress. Definitely there will be hypertension. So these are all social circumstances that require, I think, an individual tailor-made approach, depending on where you live, how you live, what risk factor are you exposed to. Thank you.
Thank you very much. Thank you very much, Dr. Ruben. So you all agree with me that the role of the media cannot be overlooked in handling these issues: hypertension, diabetes, raising awareness on infertility stigma. So now is the time for us to talk about the role of the media in reaching out to communities at grassroots levels and raising awareness on health and social issues like infertility stigma, girls' education, girl-child marriage, gender-based violence, female genital mutilation, and etc. To do that with us or to take us through is Mr. Jean-Luc Emily. He was a senior journalist with Mauritius, but now he is a senior advisor for the Ministry of Gender, Equality, and Family Welfare at Mauritius. You're welcome, sir. Let's welcome him, please.
I just hope I can give a journalist answer to what you just said before. Yeah, Dr. Ruben and earlier Dr. Francesca talk about the important role of media. This is really a big issue because every time we gather in the Merck Foundation seminar, this problematic is raised, the role of media. And I think it's very important to emphasize on the role really of the media, of the press. Well, in fact, media has definitely a key role to play. Why? Because media people, we reach people from the community, from grassroots. We are those that the community, in fact, are trusting. And when I was listening to Dr. Ruben, I was thinking about a theory in mass communication that is the hypodermic needle theory, and which is also called the magic bullet theory, which says the metaphor of hypodermic needle theory is injecting something in the mind of the people, of the audience. What media really does, media inject information, inject a message in the mind of the population. And even if there are critics from this theory of Laswell, which was introduced in 1923, but I think it's actually our role is to disseminate good information, trustful information in the mind of people. And I think our role in reaching out, it should be at grassroots level. Maybe we will start the first slide. This essential role, I think, today, people from communities from African countries, European countries have been trusting on media. And it's not an hazard that when we see surveys, when we see studies about how people trust media, I think organization, institutions that come first on the top list, it is media organization. And in so many countries, it's still be the top leading institutions in surveys. Well, health-related communication in the media have aimed to change the health behavior of the population by creating awareness and promoting prevention. We just said about how to change health behavior. All realized how much it was important during COVID period, how it was important to tell people we should wear mask, we should wash our hands. Later in the slide, you will see the Mauritian situation during COVID, how a doctor has been able to go viral on the social media, just learning people how to efficiently washing hands during the COVID period. Well, the prevention purpose of I think media is not just a messenger; it is a catalyst for social transformation. Beyond the transmission, media is actively shapes what we can say social attitudes. Today, if I can, maybe we'll go to the next slide. The transformation, the Mauritian experience. I just some days back experienced something which is very important about the transformative power of media. Earlier we were talking about adoption and foster family. On the 30th of May, we were celebrating the World Foster Day. It's the first time in Mauritius that this World Foster Day has been celebrated. And I have purposely chose a media which has not a big, I would say, big audience in Mauritius, but this media who had a penetration in the rural areas, most in rural areas than in urban areas. And after one day of sensitization, we managed to register nearly 200 families, couple with infertility problems that wanted to foster children. We have a fostering system in Mauritius, and my ministry where I work has this responsibility. Sometimes people were not aware of this foster system. And through this media campaign, through this, let's say, media, we've chosen to broadcast live a focus group, which was on the media on this particular day from this radio. And this have, in the population, we have seen messages on social media, on Facebook, on Instagram, the testimonials from parents, from those young kids who were in the system and now are adult, with their testimonials about how they feel when they were fostered by my Mauritian family. It helps to understand that those kind of information needs to reach the society through grassroots level, because so many times we have good information, but we didn't manage to have these informations to the communities. Ensuring that information reaches even the most marginalized groups. Sometimes we as media people, I say we, I still think I'm in the media, but we have the tendency to think that big information that made the headlines, that are the news that people want to listen to. In fact, it's not really that true all the times. Maybe sometimes an information which is basic for us as journalists, this information can be of vital importance for the society. Maybe we should rethink our ways of the hierarchy of information in our mind first before giving this information to people. I've taken this picture to tell you how in Mauritius, the radio, even if the trust in institutions is still declining from generations, the Gen Z in Mauritius still trust radio as a means of media to obtain news information. And I think for all of us here from African countries mainly, radio still represents a main source of information for the community. Grassroots communities often face systemic barriers to information. Media bridges the gap. We realize in remote rural areas in some African countries where electricity is a big problem, where access to internet is also a big problem, where we can have a radio with batteries, people can access to information. We should, I think, bear in mind that radio still matters for a lot of people in the community. Limited access to technology. Today, the limitations of mass communication is technology, because everything goes through technology. In so many countries today, I would say that internet access is sometimes very low. The penetration of internet in some societies, in some families, extremely low. And this is where people always have information. And I think government, the authorities need to address this problem, because this is where information can be given, and which is also where misinformation is present. Today with the fake news, we as journalists needs to give a true face of information and to address the problem of misinformation, because sometimes information from journalists on the social media is confond. People, if we don't give an information that the citizen journalist is giving, people sometimes does not trust true journalists or true media organization. They tend to think that what this citizen journalist is saying is the right information. And sometimes they accuse media mainstream of covering government, not giving good information, because we are not addressing this issue. In fact, it is not an information. It's rumors. It's not yet news. And we as journalists need to address this kind of problem as misinformation. Action for the community. How the media can address those kind of issues that I just said: to act quickly, to act decisively, and to communicate clearly. Sometimes people in the communication field tend to be those who don't know how to communicate with people. We need to do a retrospection on the way we communicate, on the way that our message reach the community. And sometimes it's important to take decision rapidly, to act quickly, because a news which is at this very moment important, tomorrow will no longer be important for the community. We need to address those kind of problems decisively and to act quickly. Media channels at the grassroots. How to communicate, how to reach a grassroots. Traditional media, you know, I said earlier, the radio, local newspapers. I don't know, there are people from newspaper in the room. Newspaper from, I know 20, 25 years ago, we are predicting the death of newspaper. The papers still been alive. It's still there. In fact, we say, you know this legendary quote, video killed the radio stars, but video came and the radio stars still exist. I think local newspaper will still exist. These are traditional manners to reach the community. We should continue to give information for these channels. Digital media today, everyone is on a WhatsApp group. We have been connected through WhatsApp before coming to this seminar, and we still be connected. Facebook Lives today are the way people follow information. What's happening in India with the plane, in a fraction of a second, people got this information around the world. This is the capacity, how Facebook Lives can connect people. Mobile health applications, in some countries they do have it. And hybrid models also, radio plus short message, feedback loops, the TV plus community forums are also ways where we can reach grassroots. We can say, I told you earlier, the radio still is a channel where people obtain information. Why radio? The answer is simply that radio still has the widest audience footprint, reaching millions who have no access to the internet. I talked earlier about the capacity of the radio, where the technology, where internet connection are very low. This is a case study in Mauritius. Les Enfants de l'Avenir is a campaign aired on the national channel and social media to raise awareness on child protection and GBV. And it integrated storytelling of survivors and expert commentary on this issue. The result is 40% increase in hotline call at the Ministry of Gender Equality. The hotline is 139. Within 3 months, we reach 40% increase in hotlines. That's to say that how campaign sometimes is very important, reaching through social media. Radio reaches the most number of people. Radio does not run out of airtime or data. Radio is democratic. Radio informs and educates. That's the reason why we should, maybe I'm from the radio, basically. That's why I'm doing my advocacy for radio. Three other case studies. Rodrigues is a small island next to Mauritius, where the community radio talks about infertility stigma and promote maternal health. It's still aired those kind of shows. Maybe it's not fashion talking about this kind of programs at 11 to noon in every day, but still this kind of information reach the communities. And you have the midwives and also the faith leaders co-hosted programs to build a trust within the community. Anyone from Kenya here? You know this Let's Talk, the Let's Talk drama, which tackle all about things that we have been talking: child marriage, reproductive health, FGM, broadcast in local languages, interactive SMS posts, which led to 20% increase in girls returning to school in pilot regions. Another example in Nigeria, someone from Nigeria? No? Earlier, we were talking about FGM and FGM social media campaign, which was an international campaign, had influence in 5 states, Ebonyi, Ekiti, Imo, Osun, and Oyo, to accelerate the abandonment of FGM. Those campaigns, which can be used through social media and local media, newspapers or radio, or even television, which can have a decisive impact on the community. Live phoning programs where we have ministers. It's very usual in Mauritius having ministers on the setup, have doctors on setup to have live phoning programs where interaction can be made. Radio and digital using our different platforms, interviews with political ministers, health professionals. That's what everyone does right now. Radio goes where newer technologies can't, beyond electricity, beyond a mobile signal, beyond literacy, because this is another reason why I put emphasis on radio, because sometimes we speak native languages on radio, and on local newspaper, we tend to use either French or English. And why radio is so impactful, because it reaches people where they are with the languages that they used to speak. I was talking about this interview of Dr. Sunil Ganesh, who is an eminent cardiologist in Mauritius. During COVID-19, he was talking about the effect and so on. And he put away his field as cardiologist to talk about how people, there's an interview, how people should wash their hand after everything. You go to somewhere, you go to the restrooms, and how to wash your hands. In a couple of hours, this interview posted on Defi Media reached 116,462 views. For Mauritian audience, in a couple of hours to have this kind of views, it's magic. It's magic. And I think those kind of stuffs from medical practitioners on very simple things can make the difference. Media role in health awareness. We've talked about influencer today. The new trends is about hiring influencers, because the younger generation, if you go to school to have someone from the medical sector talking to them, they won't listen to the message which is being broadcasted. I think today ways reaching the younger generation is by using influencer advocacy, celebrities sharing personal histories on infertility or GBV, community health journalism, local reporters trained to cover taboo topics. Earlier, we were talking about taboo topics, about topics which are very sensitive, and real-time information with social media. This lady you see on the picture, during COVID period in 2021 in Mauritius, her family organized a prayer where there were at least 300 persons attending this prayer. And it happened that she was tested positive for COVID. And it was known that people who were present in this community could have been positive, could have contracted the COVID-19. And what we did with this lady, she was on the radio, maybe the next slide. She was on radio telling people that, I'm COVID positive. All those 300 persons who were in my house this day for this prayer, you should go for a test because it is important. From the 300 person, in fact, it was the very beginning of the COVID-19 second pandemic in Mauritius, because at least 150 person from this activity was COVID positive. And she was interviewed on the radio. 49,000 people at a time reaching this information. It is for us at that time in 2021, it was the highest reach of views for a Facebook Live. Therefore, this can be situation where we can use Facebook Live, use testimonials of people to help in disseminating information. The building of network, during COVID, we have been doing programs like that to reach biggest audience. Crisis communication is considered to be an integrated part of disaster health response. Like in COVID, we should communicate when there are crises. It is important to know how to communicate during crisis. And the humanitarian side of history, communication and access to reliable information can facilitate health recovery and reduce mortality after disasters. From a historical perspective, public radio has been used worldwide as a communication method in emergencies. Every one of us here, you know how in your respective country, how the public radio has been playing a key role during natural calamities in Mauritius, the cyclonic weather, cyclonic conditions during the summer days, November, December, when the private radios didn't exist in Mauritius, people was listening continuously through hours to national radio to have information. Today, we all have Facebook when there are no light. That's a big issue for having your phone with your battery and so on. But radio, at that time, public radio was still something very important, which is always a viable source of information. I wanted to talk about something about gender-based violence. 84% of people in Mauritius from this survey say that all forms of physical and emotional abuse towards an LGBTQA+ person are perceived as unacceptable. This is a very taboo issue in Mauritius, and this survey gives some information about how people perceive information and how people get information. And it's the first time that this is a very, very high rate, 84% of people that who acknowledge those kind of violence, which are perceived as unacceptable. We never did it before, and we never had such an information. Through surveys also, it's a way to communicate in the media and communicate results of surveys. These are the main findings. It's 86% of respondents believe that gender equality is important. You would say it is a normal fact, but in Mauritius, it's always a taboo, and it's the first time those kind of information was on newspapers, on radio, and on television. The role of media in preventing gender-based violence and crimes. I think we should prioritize survivors' testimonials, prioritize their safety also sometimes, confidentiality, and the right to dignity. Because sometimes we can see in newspapers photography, pictures of we don't tell the name of a person, but we publish the house of the person. We don't say the name of a little girl, but we put the name of the parents. We as media people, we should maybe have another kind of approach to this kind of information. At 13, the place to be for a girl is at school, child marriage. This is another issue. I think media has a role to press authorities to raise the age of marriage in some countries. In Mauritius, recently, this has been an issue. Now it's at 18. Before it was 16 for so many years. And now this is an aspect where media can influence decision from the authorities. Those kind of subjects should be the headlines in your papers and your radios. Girls are not brides; they are school children. Yeah, child marriage is defined as a marriage of a girl or boy before the age of 18. How many of you in your countries is still not 18 years for the age of marriage? You know, yeah. In which country? Zambia. Yeah. There's a need, as the UN said, as the UNESCO also, to force authorities to raise the age of child marriage. Bridging the gap. I think most of us know where to go, how to reach communities, invest in community media, promote media literacy, foster cross-sector collaboration, media plus health plus education and the civil society, and support survivor voices, because sometimes people want to give testimonials, they want to express themselves. If we don't open our column or even our radio waves to those people, maybe they won't be able to address themselves to those experiencing same situation as them. How to inspire trustful community, be responsive, be reliable, be motivated, and also be active. Thank you. If you have any question.
Yes, any questions from media to media, please? Yeah.
Thank you so much, sir. I found your presentation very insightful, but I would love to request you to also go and make the same presentation to doctors and scientists and researchers, because they give us a hard time as journalists. Eh? Have you ever wanted to file a story, the editor is on your neck, you're calling a researcher, they're telling you, I am busy, or sometimes they tell you, send me that story, I want to edit it myself, I edit research papers. Some are very arrogant and mean to us. So I'm just here wondering, we are being told to help create sensitization. I hear this term media sensitization. When are we going to have sensitization for doctors and researchers and lab technicians? Some of them are very arrogant. Sure. Thank you.
Yeah, I'm I join you in what you said, because I've had a previous life as a journalist and I know how it works. It is important to sensitize medical practitioners, because when earlier you said truth, the real information, they are from their mouth. Sometimes they don't want to communicate, but if still in the ministry there is, a press attaché, there is a communication advisor. We should reach those persons if sometimes they are reachable. Yeah, but they should see it in another way, to protect, but to put light on him, on his work, on what is happening for the ministry. I think I'm totally now. I've done a 360-degree shift, and I realize how much my experience from the media is important to help the ministry where I work, to communicate, to be. I maybe some people can say that I over communicate, because before the journalists come to me to have this information, I've sent the information to them. Maybe this kind of approach should be created, but I realize that sometimes it's very hard for people to have access to information, true information, and this is, I think, medical practitioners in our countries should be sensitized about this issue. Yeah, thank you.
Yeah, Mr. Jane, you mentioned about radio being remained because according to your tutorial, you do a case study within your country, Mauritius, but there are other countries it's different. Have you heard about bloggers?
Pardon?
Have you heard about bloggers?
Bloggers, yes, sure.
Okay. And in your case study, you said radio remains the most trusted and accessible source of information in many rural areas. Here, I'm from Sierra Leone. We understand how the digital system is rapidly growing. At the moment, we as the print media or radio, even the government trust the bloggers than us. And we as a print media or a journalist, before giving an information, we know we need to get the full source. We need to do an investigation or edit before you do the publications. But bloggers never. The moment they came in here, they come and they get the information, they just give a brief headline. So the question is, why are government and international organizations still disproportionately investing in digital communication strategies that fail to reach the most vulnerable, especially in times of crisis? That's the question.
I think it's both works, radio plus digital communication, because today a video works more than a text. You realize when you post a video on social media, the hits, the reach is greater than when you post text. But I would justify my position through your question with an example that we last year in November there was general election in Mauritius. The electoral campaign was very traumatic for Mauritian people because there had been a leaks in the Mauritian media where we come across some ill doings of the ruling government at the time, where people around the prime minister, the former prime minister, were working for covering issues. There were all kind of things that we've heard, but never have, how to say that, justifications or proof. And it was in the leaks. It was audio leaks, recorded conversation between people, and so on. And to be able to frame this viral on social media, the government decided to ban Facebook, Instagram, or social media for 1 week just prior to the election. And what happened? This had a fallback situation on them because those youngsters were actually every day on social media from when they go out from bed and where they go to bed, they were on social media. They seemed that the liberty was being refrained and it was not good for them. And what happened? Radio stations have been able to, from the time nearly 24 hours, we didn't have internet and social media in Mauritius, and radio stations, but they were still broadcasting those leaks. That is where radio can step in, where social media, when digital communication, because you at any time a government can decide to freeze the internet. This is possible. But the radio station, if they don't have access to the waves, they can also do it. But it's more easy for them to freeze social media but the radio still give information. And the result is they had not been able to secure even a seat during this election.
No. No, man, it's really not a question. I just want to. Am I the only doctor remaining now? Yeah, I just want to react to my brother from the land of Jomo Kenyatta here, who want to sensitize us as doctors and
That's why I was
researchers.
looking at you.
Yeah, no, I saw that. Yeah, no, but I welcome that. I welcome that. You see, now we know the role of the doctor, the role of the media. But I think in maybe, I don't know, where we meet Merck Foundation to discuss harmonization of this relationship in between the doctors and the media. It's true. In my roles as the head of the referral hospital, there are really moments when I ran away from the journalist, but it's with reasons. I'm not so well versed with journalism, but I think you have different form of journalism. One being an investigative journalist. Yeah, I think we need to harmonize that relationship from the backgrounds of ethics in our work, both of us. Yeah, because I can give a classic example. We invited journalists to an event where the hospital was receiving a donation of hemodialysis machines for dialysis unit. And then one of the newspaper reported that 30 patients dies of Shakati Hospital is where I work. 30 patients dies at Shakati Hospital every year. That was the heading. But the event was about the donation. Now imagine somebody who don't have time to read the whole article. You just read the heading and they make conclusion. You understand, eh?
My answer to that.
Yeah, just a minute. So my own conclusion now, as newspaper, there's also an element of business. You must sell. And the search heading, I think, that's my assumption. You can correct me. I think make you to sell more. It attract. It attract, and the people want to grab, especially who have interest to read until the end. They will definitely buy. And then you find now when you are doing your investigation on stories, there are journalists who don't come out clearly disclosing what they're out for. They'll come undercover and they start asking me to give information under false pretense, which I find unethical. And now and also the tones in your question, sometimes you send questions right then one, and the tone in the question, there's already a bad connotation. Just the way it's coming out, you don't know why is the hospital doing so many bad things. Do you understand the tone? What do you expect from me? Thank you.
So may I respond? Number one, I appreciate that you invite journalists to things, but you must also remember that journalists work with you. They don't work for you. Okay? So our editorial independence gives us the right to determine what the story is. So when I come to your hospital, you have called me, you are launching something nice, and I discover that the patients, you are giving them expired drugs will be my story, because that is more relatable and more pressing than your launch. Because you have called us there, you also want marketing, you see. Yes, and then on how we do our things in terms of going undercover in investigating everything of every of these things have a modulus operandi. But what I was generally referring to is some doctors don't want just to talk. Even if you ask them what is COVID, you know, they will take you in circles, you will send an email. Now, when they're in a crisis is when they remember journalists are important. All in all, I think we need to understand our roles and how we work with each other. Because I think many people assume journalists work for them. We don't. Thank you. Even we don't work for even our editors or those newsrooms. We work for humanity. Yeah. Thank you.
And I can maybe one minute. I would like to to respond to what you said in a French sentence, it's info ou intox, information or intox, because what people give, what medical practitioners or authorities, institutions give to journalists, it's not information. It's the message you want to be broadcast, to pass. What the journalist is looking for and what you are not telling them is information. That's the way it works. You should understand that point. And maybe today I have no problem to say that with AI today, journalists are more lazy. Okay, and they can work on a communique. You send a press communique, and they take from the first line to the last line. They can publish it like it is. I've experienced it recently, but they can drag the community, the communique in the AI and generate something more potable that can be broadcasted. And maybe also the narratives of the authorities is important. If you want something to be broadcast as you want it to the donation, your narrative should be going to the donation and not leave, the flooding gate. The media can use anything that you've given to publish the information. Thank you.
Thank you, Mr. Jain. It was indeed a good session, I guess. Everybody liked it. Before we call our next panel, I would like you to all watch the promo of Our Africa by Merck Foundation TV program. Our Africa is a Pan-African TV program that is conceptualized, produced, directed, and co-hosted by Senator Dr. Rasha Khalej. The program features African fashion designers, singers, and prominent experts from various domains with the aim to address and raise awareness on various sensitive health and social issues. The show has been broadcasted into many countries in Africa, including Malawi, Botswana, and Namibia. Currently live on NBC in Namibia. Please play the promo.
Senator Dr. Rasha Khalej and creator of Our Africa TV show.
All Africa will be part of our show.
The CEO of Merck Foundation.
We want to support girls' education. No to infertility stigma, yes to girls' education. We want to stop gender-based violence for stop. Number of child marriage will double by 2050.
We will now proceed for the panel discussion. The topic for the panel discussion is how can media be a creative and honest tool to address our sensitive and critical social and health issues on a daily basis. Let us welcome the panelists for the session who will be sharing their views on the topic. Mr. Pedro. We'll wait for him then. Ms. Giselle, Vice President, Cabo Verde Journalist Association from Cabo Verde. Ms. Fatima, Editor, DeFi Media, past Vice Chairman, Media Trust, Mauritius. Please. We are waiting for Pedro, but we can start our session. Pedro, please.
Hi, everyone. Very happy to be back with Merck personnel and all of you here again. I'll start. The topic of the day is how can media be a creative and honest tool to address sensitive and critical social and health issues on a daily basis. So my name is Fatima Kapere, and I'm a journalist in Mauritius. I have been journalist for 20 years, and over the years, I've seen how media, when used thoughtfully, can change lives, especially when we deal with sensitive social and health issues. I think you're all you will all agree with that. The responsibility of media, I'll start by that. Media is a powerful platform. This also, I think you all agree. That's why we do this job as well. But with that power comes responsibility, not just to inform, but to educate and amplify the voices that are often unheard. Every day, we are faced with issues such as domestic violence, mental health issues, gender inequality, and access to healthcare. Those are subjects that are sometimes silenced by stigma or social discomfort. I won't be telling you anything new today. We are in the afternoon after the lunch, and all the experts since this morning have been telling us the same messages. Bottom line, we need to be aware of our duty. So it is our duty to break these silences, but with honesty and with sensitivity. How do we do that? We can give a voice to these issues. We don't just tell stories to people, but we put forward real great issues. We open minds, and sometimes we even influence policy, just like experts before me told us. Let me share a concrete example. Where I work at the radio station in Mauritius, we host a program called Explicuca. In English, Tell Us Your Problems, where we listen to those, especially in vulnerable situations, the one often overlooked by the system. Through this platform, we also connect them with resources, NGOs, and public institutions that can help. We even do a follow-up afterwards. After the program, the radio program, we even do a follow-up to ensure that their problems are resolved. And this was for the radio and for our print media. For our print and digital edition, we publish health-focused articles, topics like eating disorders, cancer, fertility struggles, and palliative care, which is more and more talked because of cancer as well. But we always have to keep in mind the emotional and cultural dimension of our audience. This as well has been talked earlier. This shows that media does not have to sensationalize to be effective. We can be effective without bringing hot titles. And my last slide, my last topic will be about creativity with integrity. I think this is all about today's topic. So creativity is crucial, especially today where attention span are very short, but it should never come at the cost of truth or dignity. We have to fight fake news. This also has been spoken earlier. We have seen as well the challenges we had during COVID-19, how so much misinformation was spread, and how the media took part in putting forward the truth, the real information. And lastly, I will end with, we need to know our audiences and adapt our messages. From my point of view and from where I am, we have a health website dedicated to health and wellness. We have this year 2 new programs that we launched. The first one is in French, Côté Cœur. Côté Cœur in English is all about the heart health. This is a daily and a weekly program that we put forward every messages regarding the heart. It's very specific. And the new one, this is the very interesting project I've worked on. In English, it's in French, it is le dictionnaire médical. And in English, a health dictionary where we explain medical words, complex medical words. I think the doctor will agree with us. We have medical words that not all people understand. Not my grandmother or 70 will understand around cancer, around hypertension. So, and going to the doctor, you have maybe 15 or 20 minutes with one patient. You don't have the time really to break down those information, those complex words. This is where we thought at our media house that coming with specific shows, trying to narrow things and explain every day one word can in fact build up and make that education for the public. So that was all for me. Thank you very much.
Tá bom. Bom, boa tarde a todos e a todas. Eu sou o Pedro Miguel, venho de Angola, e quando li o tema que propuseram-nos para apresentar, para discutir e refletirmos juntos, eu alterei lá uns aspectos, né? Fui mais direto e coloquei assim. A mídia como ferramenta ativa na abordagem de questões sociais e sensíveis no cotidiano das comunidades. As questões sociais têm muito a ver com a própria saúde, temas ligados à saúde e à educação. Mas pensei, o que seriam então as questões sensíveis? Bom, e eu pensei logo, bom, as questões sensíveis provavelmente têm a ver com política. Bom, será que é isso que se pretende? Está bem, então vou tentar escrever um pouquinho sobre aquilo que a própria história dos mídias nos apresentam como objetivos que justificam a sua razão de ser, a importância para as comunidades. Todo aquele que estudou ou estuda ciências da comunicação ou mídias saberá alencar os objetivos que circunscrevem em informação, recriação e formação. Destes três objetivos, vamos nos cingir na formação, porque entendemos ser este o centro do objeto social dos mídias que melhor se enquadra ao tema. Mídia como ferramenta criativa na abordagem de questões sociais e sensíveis no cotidiano das comunidades. O caráter formativo dos mídias, ou dos meios de comunicação social, enquanto instrumento de mediação social, visa a promoção de valores culturais, influencia na mudança de atitudes dos ouvintes, telespectadores, leitores e cinéfilos. Bom, eu que trouxe a questão do cinema, porque o cinema também é mídia e todo realizador do cinema deve ter sempre em conta a temática ligada à promoção de valores. Então, a Fundação Merck manifesta de forma contínua a preocupação da necessidade de uma educação integral das comunidades por via da comunicação social tradicional ou digital, de forma de imprensa, televisão, rádio, cinema, etc, etc. Em matérias essencialmente ligadas à saúde pública, às questões do gênero, violência sexual e doméstica, a infertilidades e doenças infecciosas, os casamentos infantis, o mesmo se pode aferir da problemática referente à pobreza material e espiritual. Pretende-se, com a inclusão dos mídias, no caso, meios de comunicação social, nos processos e objetivos da Fundação Merck, maior disseminação de informação vital e essencial em locais periféricos, onde o Sistema Nacional de Saúde, os seus resultados são incipientes em relação aos grandes centros urbanos, níveis de alta sustentabilidade econômica, potencializando estas comunidades de conteúdos essenciais em matéria de saúde pública, que a população possa, por si mesma, dar resposta aos problemas de saúde e outros com poucos recursos ao seu alcance. As formações humanas integrais realizadas pelos meios de comunicação social transcendem o aspecto meramente informativo, como o facto noticioso que ocorre em uma determinada comunidade concreta. Os mídias permitem a promoção e democratização de instituições comunitárias e o desenvolvimento humano na sua dimensão espiritual e fisiológica da alma e o corpo. A formação é componente humanizante dos mídias, que permite ao indivíduo desenvolver a capacidade crítica e valorizativa do bem comum, ao mesmo tempo que desenvolve também o princípio de pertença e identidade, o sentimento de responsabilidade social e comunitária. Para os mídias para que os mídias correspondam com a exigência formativa como ferramenta criativa na abordagem de questões sociais e sensíveis, é necessário que ela se manifesta, seja capaz de acolher as diferentes manifestações culturais e ideológicas. Exato. Então, para que os mídias correspondam com as exigências formativas, como ferramenta criativa na abordagem de questões sociais e sensíveis, é necessário que ela se democratize, seja capaz de acolher as diferentes manifestações culturais e ideológicas, construtivistas da pessoa humana, expurgando todos os preconceitos suscetíveis à degeneração da comunidade. A democratização permite que emergem novas formas e técnicas que concorrem para a educação ontológica do homem, no espaço e tempo, sem descurar a possibilidade iminente de promover a consciencialização para uma vida social, política, econômica e biológica. Saudável. As novas tecnologias de informação e a revolução tecnológica vieram por si só alterar o formato dos meios de comunicação social em massa, tornando-os mais eficientes na divulgação de conteúdos, não só informativos, como também aqueles de pendor pedagógico. Sim. O jornalista deve ter a capacidade de conhecer o meio social. Sobretudo as debilidades cognitivas das pessoas da sua comunidade e as necessidades formativas, cabendo-lhe elaborar uma grelha temática como a educação sexual, violência doméstica e sexual, gravidez prematura e casamento infantil, temas que em muitas comunidades ainda é tabu. O jornalista deve ser o facilitador para o efeito. Deve-se convidar especialistas de diferentes áreas do saber em saúde pública, sociedade e economia, sobretudo nos programas radiofônicos e televisivos com maior audiência. Isto proporcionará à comunidade o esteio para aprendizado e libertação da ignorância involuntária. É importante que se reconheça que em muitas comunidades do nosso continente, em particular Angola, meu país de origem, apesar dos avanços tecnológicos dos meios de comunicação social, com um satélite próprio, ainda existem comunidades desprovidas de uma televisão e de internet. Para estes casos, a responsabilidade é do Estado, que deve criar condições e logo que existam, numa primeira fase, construir-se, naquelas comunidades onde não existem, construir-se jangos ou moanza. Jango ou moanza são lugares onde se pode congregar pessoas onde poderá ser colocado uma televisão ou um ponto de internet. Isso vai permitir que a comunidade possa ter acesso à informação. Já para terminar, vou trazer aqui uns dados que um dos problemas da nossa ignorância em matéria de saúde pública tem muito a ver com a falta de literacia. Quer dizer que a nossa comunidade ainda é analfabeta. Daí, os meios de comunicação social também podem ser um instrumento para a escolarização. Como, por exemplo, como já Moçambique tem programas televisivos, tem rádio, que são uma escola, tem horas próprias para se ensinar as pessoas a lerem e a escrever. Angola também imitou Moçambique, sobretudo na época que tivemos a Covid-19. Com certeza que, ao transformarmos também um espaço de aprendizagem científica, etc., etc., os mídias poderão sim ajudar para que as pessoas saiam da ignorância em que se encontram. Muito obrigado a todos. Thank you. Merci beaucoup.
Hello, I will try to do a little bit in English, but maybe I will need a translator too, because English is not my main language, it's Portuguese too, but I will try to do my best to not cause more delay. My name is Gisela. I'm more than 20 years I've been a journalist, editor. I'm Portuguese, but I almost 20 years in Cabo Verde, where I live, where I work, and I will try to bring you a little bit of my experience in Cabo Verde. I don't have a magic potion to how can we improve and give a higher contribute to the healthcare in our countries, but I start asking something for you to think about that, and in the end you will telling me is that when was the last time that we wrote something, a big report on television or radio or in the press. Last time we did a report about healthcare in our countries, because sometimes we only write about healthcare when there's a pandemic, a huge virus, or a massive death, when a tragedy happens and is related, connected with the healthcare, because healthcare is a human right, and sometimes population don't have that awareness that it's a human right. They have the right to have access to healthcare, even if it's combating the cancer, diabetes, hypertension, infertility, like we heard this morning, because in Cabo Verde we have huge problems of diabetes too, and hypertension is been increasing in the young people, in the older people too, because we is connected with our health habits of life and the food we eat, and if we practice sports, and it's been increasing in Cabo Verde. I don't know the other countries. In Rwanda, we heard the colleague is saying that this is being increasing too, but it's a reality. And how can we improve that, and how can we give information to the population? We must work together and near the communities, the rural communities, not in the urban space, because in the urban space, in the cities, population have more access to information. They have more access to internet, they have more access to television, they have more access to radio. But in the rural communities, there's a lack of communications, so of information. So we need to get connected with the rural communities, because we journalists, we are the voice of those communities. If they have a problem, we must be there to help them to I get lost now, I'm sorry. Vou tentar falar um pouco português. O que eu estava a querer dizer é que é muito simples. It's very simple. Yeah. Aham. É muito simples. Nós realmente, nós enquanto jornalistas temos a obrigação temos a obrigação, de dar voz às pessoas. Às vezes nós ficamos perdidos um pouco nas agendas políticas. Uhum. E esquecemos-nos de ir aos centros de saúde, de ir aos hospitais. Uhum. E tentar ver como é que as pessoas se sentem, quais são os seus problemas. Uhum. Porque hoje em dia, porque hoje em dia nós, devido à globalização Uhum. Devido à globalização, por vezes nós ficamos muito concentrados nas redações e esquecemos de ir ao terreno. Exatamente, e é no terreno, nas comunidades, que nós ficamos a sentir realmente o que é que se passa. Uhum. Porque muitas vezes nem sempre a população tem como chegar à comunicação social, especialmente. Portanto, na minha humilde opinião, é um dever nosso da mídia chegarmos às comunidades. Caso contrário, é difícil, sermos as suas vozes e transmitirmos. Uhum. Cabo Verde tem apostado muito na formação de jornalistas, incluindo Uhum. Incluindo com o apoio da Merck Foundation. Uhum. Temos tido alguns treinamentos em, jornalismo de saúde. Uhum. Como forma de termos consciência precisamente daquele que é o nosso papel e como podemos. Uhum. Porque uma coisa fundamental, é democratizarmos o acesso à saúde. Exactly. Ah, relativamente às questões aqui que vimos esta manhã em Cabo Verde. Uhum. Em Cabo Verde também temos, como já disse, diabetes, hipertensão. Violência baseada no género. domestic violence. Yeah. Children marriage too, because we have a lot of immigrants from the African Occidental coast, and they have some practices of genital mutilation too, and it's a huge problem there too. Okay, I want to try to speak English, but but the main key, I'm almost ending. The main key is to give voice to the communities, the rural communities, because there's a huge lack of internet in the rural communities in Cabo Verde. I think it's the same in other African countries. We have to improve the capacity, availability of the journalists, because if sometimes we don't have all the conditions, even if we want to we want to go to a hospital or a medical center in the other side of the country or other side of the island. Cabo Verde is 10 islands, each one has their own specificities, and there's only two central hospitals in 10 islands, only 2 central hospitals. It's very difficult. We have lack of specialists, medic specialists, doctor specialists. So that's why in the morning I was saying that frozen eggs is very expensive there. There's no frozen eggs in Cabo Verde. We have to fly to other countries if women want to do that. So that's why I was saying it's very expensive, and it is. So, and then there's a very important other thing, I'm almost ending. If we want to pass the right information, we have to have access to the right information. Doctors can give us the right informations, but they have to simplify the words. That's the problem. When our colleague was saying the morning, synthesizing is help us to have the more simplified words to pass the message to the population, because there's a lot of technical medical information, and we need to simplify. Otherwise, people won't be able to understand. That's the main issue. I could say so much, but it's okay. Thank you very much.
Thank you. I would like you to, for the group photograph, please. Please, guys, stand up. Like we are having a group photograph. Yes, don't worry. I want the other speakers, both of the speakers, to join them too.
Any questions for this section, please? Those online, Those online, thank you for your active participation. We want to know if you have any questions, please send them in and then we'll get them answered.
Thank you very much. My question has to be with, I've not heard as much talk about the safety of journalists and well-being of journalists, even as they dig into these critical stories. Because I have seen my friends going to rehab because of covering COVID, developing mental health issues. Some of them are still in those mental health institutions. What are we doing to address the mental health and well-being of journalists? I've seen across Africa, journalists are poorly paid. In fact, I think journalists are the most poorly paid people on the planet. So when I hear words like building capacity, I wonder, are you building capacity for our employers, or who exactly are you building capacity for? Secondly, the reason why I'm addressing safety is because just early this year, there's a story I did on how cartels were trafficking kidneys, harvesting kidneys from poor people in Kenya. And people are coming from as far as Israel to get those kidneys. I had to flee the office for almost a month because security told me strange people were coming to ask about me and look for me. So I've seen some of my colleagues also end up badly. Some have had to flee the country because of some stories that must be told, because if we don't tell them, no one will. I'm glad the story has had the impact. We've seen the government set up a new committee to investigate the hospitals that are having those issues. But still, to be honest, I still look over my shoulder every day. Yeah. You have to change routes, you have to adapt and do those things. We rarely talk about those things because this job is demanding. I know, like the day before yesterday, there were protests in Kenya. I mean, my colleagues saw a police just shoot someone in the head, point blank. Some of them have not recovered from what we see out there. So what are we doing, even to a large extension, to Merck Foundation, to help journalists also have these safeguards? Thank you.
I don't know if you want.
Okay. So I'm not from any union or association. I am from Media Trust, but Media Trust is mandated for training only. What I can say in a few words is training is very important. We need to get ahead. We need to be educated ourselves before we can educate others. Even we can't write about mental health, raising awareness for the population and not being self-aware. So we need to take care of ourselves as well. We are human. We need it. It must start with us, and it goes the same way with the medical field. We are all health journalists. We need to educate ourselves continuously about diabetes, hypertension, and so on. I'll give you just two examples, which is funny and sad. In Mauritius, we have a very high rate of diabetes, but people don't really understand what is high blood sugar, how the medication work, how to take care of themselves. But we do have campaign going on and on, but somewhere something is missing. I have someone, I know a particular person that went to a doctor. He got diabetes. The doctor told him, now you cut sugar, no sugar for you. He came back home. He went to the supermarket. He bought 12 packs, a pack of 12, juice, no sugar added. No sugar added. I can't mention the brand, but no sugar added. He went home, drink only that. He's not drinking his habitual juice, but he's drinking that particular juice with no sugar added. But it's no sugar added, but there's fructose, sucrose, everything else. Look, he was admitted with a diabetes of over 20 points. There's something missing in the communication chain. We have another example of diabetes as well. Yes, diabetes as well. An old lady. I think a topic we didn't talk about is addiction on sugar addiction. How difficult it is to get off sugar. I know I've known someone, a lady, an old lady. She want to eat sweets. There's Indian sweets at our place. Our ancestors come from India. We have a very attachment to Indian sweets. We laddu. And that particular woman wanted her laddu. And she said, I will eat that laddu and then drink my medication. So there's something missing in our in the way we educate people, and that's why it's important to start with us as journalists, to educate ourselves, to take care of ourselves. Then we can go ahead. Yeah, that's all. Maybe I didn't answer your question. I'm not from an association or a union. Maybe my friends can carry on. Thank you.
I will just say a few words. You touch a very important thing, that is mental health of journalists nowadays. It's a problem we have in Cabo Verde, and I don't know in other African country, but we have that problem connected with COVID too, because most part of them were sent to home working by home. And related to the consumption of alcohol. It's a huge problem in Cape Verde. We have a traditional drink, it's called grog. It's like rum, but it's Cape Verdean. And the consumption is being increasing even in our community journalists because of other problems like the freedom press is not very well there, like other countries, and related to work conditions, your salary, your pay salary, and we are not giving too much attention to that problem. And we have some journalists, they have to, we call it, go home without working because of that. And now the government is launching a campaign, national campaign, the year of mental health, because they start to seeing it can be a huge problem in a few years. So it's very important to take care of each one of us. If you want to do a report that is critical, you have to be prepared. We have to prepare ourselves, but we have to do our homework too. We don't need to wait someone to be preparing us. We need to do our homework too. That's I hope I was useful.
One thing. I would like to maybe add to what have been said about security. There's two aspects, security and mental health. In Mauritius, we don't have this kind of security issue. Maybe people or political influence people can call your boss to say that I'm not happy with this article that has been published. And most of the time, your editor-in-chief, your director would not intervene in what you have written. But sometimes the only fact that they call you to say that I receive a call, it's a kind of, intimidation to say, beware next time, don't try to, this is a real issue. But I've met someone, I don't know if you know this journalist from Burundi, Bob Rugurika, which was an exiled journalist. He won the prize of CNN award the same year as me in 2016. And he was explaining how he had to go out of the country, remain in exile for so many years because of the political situation in his country. I think many of us journalists in some countries are facing this kind of situation. And I think authorities should press upon, media organizations to look into the security of their representatives when they are on field or when covering news information. That's the biggest issue. It's the biggest issue because before that, I think we should have journalist association, which being which can advocate for better situation, which can advocate for more security for journalists, and unions, journalist unions, who can stand up and fight for the right of journalists. Because in my country, we have the chance to have really press freedom. But sometimes at let's say electoral times, it can be very hard for journalists. But during the 4 years coming, that's it. But the second thing I would like to say about mental health, today the issue in news organization, the news organizations are being run like businesses. There's an economical power that is today influencing the editorial line first, and then the economic model is no more viable, and they are firing people, reducing a newsroom size. And this is an important issue. You go to work this morning, you can receive a letter from your direction saying that we will not be able to keep you to keep your post. And this is a real issue, because today, from the COVID period, people are not going to the newsroom. They were working from home. This is another issue, because we are not mixing with others. We're not meeting our colleagues. We are working far from the newsroom, and this is another big issue.
Political, cultural, economic, everything. We don't have exactly. That's the problem, and we are reducing the journalists. And you have to do one journalist sometimes has to do three, 4 reports in the same day to cover the lack of people to work. That's a huge problem too.
Bom, eu pego as últimas palavras daqui do companheiro quando se às liberdades, quando se referia às liberdades. Claro que essas liberdades, a um dado momento, são condicionados justamente nesses períodos eleitorais. Quase que os contextos são para a África, temos muita coisa em comum. Mas eu gostaria também de falar sobre a proteção do jornalista. Nós, o Sindicato dos Jornalistas Angolanos, está afiliado ao Comitê de Proteção dos Jornalistas. Nesse comitê, funciona como que é o espaço que nós reportamos tudo aquilo que o jornalista eventualmente, se tiver a ser molestado, possa queixar-se e pedir a proteção. Então, o sindicato que faz quando um determinado jornalista, porque o nosso problema não tem muito a ver com a saúde mental, o nosso problema é mais político. E há uma instituição que executa as orientações políticas, no caso, a polícia. Então, nós, por vezes, começamos por dialogar com a polícia e depois vamos dialogar com os políticos. Porque o polícia, porque é um órgão de repressão, os efeitos são imediatos. Na nossa classe, hoje estamos a ter o chamado o jornalismo de cidadania. Então, por vezes, Esses jornalistas que se dizem fazer jornalismo de cidadania, deturpam o verdadeiro sentido do jornalismo e colocam aquele que é o jornalista que exerce a profissão com rigor em perigo. Então, quando se fala em proteção, nós estamos a falar também da conservação das liberdades. E temos como estratégia agirmos como as águas do rio, contornar. E manter o diálogo constante com as instituições, tanto policiais como as políticas, no caso, administrativas.
We have a question from my media doctor friend.
No, thank you so much. You know, I'm learning more and more about your work today. I just wanted to know, you see, you are now sitting there on the side of health advocacy. But here, as explained by my brother here, you also have, press freedom here. You operate within the confinement of press freedoms. How do you strike the balance between the two, being health advocacies, and at the same time you remain within the confinement of press freedom? Because you can report something, you say it as it is, but it may create a bad reputation for institution, for individual. If it's a hospital, it may create fear for the people to come to that hospital. If it's a doctor, it may create fear, but you have said it as it is. So how do you strike the balance to be creative, honest, say it as it is, without stepping on your other side of being health advocacies?
Thank you. First, our job is to be truthful, honest, and factual. Our job is not to care about the image of institutions. Yeah, each institution, I think, has a PR department or a communication department. So even as a nation journalist, it's not my job to care about the image of nation. There are people who that is their job. So my job is to investigate. If you are doing something wrong and the public has a right to know, we will tell the story as it is with truthful objectivity and facts. And then number two, we have the code of conduct for journalists, I believe, in every country, which we adhere to in terms of reporting. So you have to be very ethical. There's what we call journalistic truth and what we call government truth. That's what my lecturer used to say. So the government can say 10 people died, but when I go and count, I see 15 people. It is my job to say the government is saying 10 people, but I counted 15. That is how we approach it. Yeah. So these things happen, and we were raising concerns about police because personally, last year, if you follow Kenya news, there was the Gen Z uprising, the protests against the president. I was filming along a road and 6 policemen came, one beat me. I was abducted for 4 days. Those things happen to us every single day. So the point is, they affect you as a person. Because I remember being in a police cell, all I could hear outside, it was so dark, all I could hear outside were screams of women, female journalists in the other room. Whatever happened to them, only God knows. And those are fears. So sometimes you go just doing your job, but someone else has another agenda over even a story you did and you forgot. So how do we navigate? Thank you.
Yeah.
That's our commitment. In the truth, in the public service. That's our commitment.
It's a public interest, as you said. Just what you said earlier about the fear that people will not come to this hospital. I would take it the other way. If this hospital is serving food where they can be get poisoned, I prefer that people don't come to this hospital than never said it and people go there and being prosecuted for non-assistance to endangered people. That's the way of thinking of journalists, I think. Really.
So Trifina has a question.
All right. We're not finished.
Yes. No, it's not actually a question, it's just a contribution. I really totally agree with the safety of journalism. It's real and it's happening. But why are we so harassed? Why are we not taken seriously as journalists? I think it calls for us in the industry that we need to advocate for ourselves. We need to create that awareness, the importance of the media. As we play our role as a watchdog, people need to know. We need to create that, and the government as well as the politicians, because if we don't make them to know, then they're going to harass us and take our cameras or put us in prison. So it's upon the media organs, the journalists, everyone that is in the media to create and advocate for their role that they're playing in the society. Thank you.
Based on your presentation, you've indicated that access to some fertility services in your country is a problem. And more often than not, if you're a journalist, you do stories with the intention that they'll inform policies. So it's called, yes, your country, sorry, I can't pronounce that. When it comes to even just having the government take action, like something like freezing eggs, forcing a woman to leave the country to go and seek for these services elsewhere, yet health is a right. What is the challenge when it comes to that? Is it that it's not a concern for the government, it's not a priority? Or is it that the population still doesn't understand issues to do with fertility? Like, where is the challenge?
We don't have statistics about infertility, for example, but the population is poor. Most of the population is poor. The medium salary is 150 euros. 150. 150 euros. 150 euros is the medium salary. And then the issue of infertility is not a huge urgent issue. Yeah, it's not a priority, exactly. It's not a priority because we have other priorities, you know, about cancer, death of neonatal death, babies who born death. We have in the last year, because of we have an hospital where some the death increase of babies born death increased, and the hospital tried to Yes, and we have some problems with the journalists who try to reveal the truth and the numbers of the death-born babies. So it's not a priority because the country has other priorities. Like I said, we only have two main central hospitals in 10 islands, two central hospitals. Yeah. And then if there's a emergency, you have to evacuate to other island, and it costs a lot because you have to take a plane, to rent a plane, and when we are talking about islands, it's very difficult to keep the balance, the development balance between all the islands in the same way. There's no equality. I hope I can be useful.
Yes, so
alpha million. We are only alpha million. Yeah.
The conversation and the discussion could get on and on, but I think it's now time to wrap up. Thank you so much for your contributions and your meaningful submissions. So I know that we did not do a self-introduction before we started the program. Would encourage all of us to interact while we close the section, and then we'd like to encourage all of you to also apply for the awards. Merck Foundation, submit your entries. Before we go, Mehak is here. She would like to say a few words to all of us. My name is Linda Nadide Aite from Ghana. I have been your moderator for this very section, and thank you. Together with my colleague Patience, thank you for having us.
Hello, good evening, everyone. I'm sorry that I couldn't meet you all earlier. I said hi to some of you, but not everyone. But it's a good opportunity. I'm sure you all have introduced yourself within, the groups. But let's do it in a very formal way now, so that we all know your names. And you guys have been with us for a very long time. There are few new members. For example, I have my friend here, Mackie from Sierra Leone. He's joined us for the very first time. Gloria, my friend, has been with us for a very long time, and I must appreciate, people like her, Jean-Luc, Fatima. Many of you are always there when I message for anything, and you're there to provide the support from your country, because we are working remotely. We cannot be in all the countries, but if we need some information, that is the relationship that we want to build with you, that you provide a support from your country. Trifina has always been very, very helpful. Cassian, of course, works very closely with us. Just last year, we made friends with our South African journalist, Kamotso, and she has also been very helpful. Thank you so much, everyone. I cannot take all the names. This guy has just joined, and he said a few Hindi words to me, and I was amused yesterday. And then he told me he's studied in India. So that was really nice. And I want to say thank you to each one of you, and those who are joining us for the first time. I will only request support from you going forward when we need something from your country. And we also need from you is, for example, I talk about Mauritius. I am meeting you for, I think, the 4th year now. And also Jean-Luc. Jean-Luc was the first person I met when I joined Merck Foundation like 6.5 years back. He was the first person. But we don't get many entries from Mauritius for the media awards. Cabo Verde just came on board, and they are like shining, and they have many winners. But from Mauritius, like not even one single entry that we can consider. So we need your support. We want the journalists there to apply. I don't know what is stopping them to apply, because I'm sure they will write amazing stories, and they're already writing on these issues. It's not like they're not writing about girl education, they're not writing about infertility stigma. So if they share their stories with me, we would want to reward them, award them, and recognize them. So this is my request to you. Angola also, Pedro, my friend, is meeting me for the 4th or 5th year now, but very little English, Pedro.
So he promised me that next year when he comes, he'll be fluent. He will be fluent. And Gisela has also, supported that, okay, I will teach him. So we will start with the round of a brief introduction. Just talk about your name, your country, and which organization. Many of you are working with or contributing to multiple organization, if not multiple organization, but multiple platforms of one organization. For example, Gloria, I see her reporting for TV, writing for online articles, and also for the newspaper. So talk about it so that we know more about you than just the name. So let's start with Fatima here.
I start. So I am Fatima Kaperi, journalist since 20 years from my local media house, Le Défi Media Group. And we have newspaper, printed, radio, website. Yeah. And for the print session, we have dailies and weeklies. So it's kind of a
Amazing.
wrap-up.
How many years did you say?
20.
20 years. We must clap
Yeah.
for this. She looks so young. I feel like she has only 5 years of experience or something.
Thank you.
Eu sou o Pedro Miguel, sou o secretário-geral do Sindicato de Jornalistas Angolanos. E sou jornalista há 36 anos da Rádio Nacional de Angola.
Uau!
E agradeço aqui a paciência que a MEC tem tido comigo, sobretudo porque nós ainda temos uma barreira, que é a barreira da língua. Que, com certeza absoluta, nos próximos eventos, esta barreira poderá desaparecer. Talvez apareça ou eu aprendo a falar o inglês, ou a MEC aprende a falar português. Então, eu gostaria que, para além desses eventos, para além do secretário-geral do sindicato, que sou eu, também viesse mais colegas angolanos a participar desta formação, para além daquela formação que é feita por via remota.
Thank you so much, Pedro. Let's give him a hand, please. Round of applause for all our panelists, speakers, and each one of you, all the attendees. Gisela.
Hello, as you know, I'm Gisela. I have more than 20 years of as a journalist too.
Amazing.
I work in the newspaper. Nação is the biggest private or communication media in Cabo Verde. We have a radio too. We have an online website. And I'm director of economic magazine, tourism economic magazine called Initiative. It's a business magazine. I'm vice president of the Union of Journalists of Cape Verde, and I belong to the Human Rights Committee too. That's why
Great.
I was saying that health is a human right. Everyone should have access to healthcare.
You are right. You are right. We also believe in the same. That's why we are doing what we are doing.
Exactly.
This is not a privilege. Health is not a privilege. It should be a basic right. It has to be.
Mm-hmm.
Thank you so much, Gisela. Thank you.
I think it's everything.
Hello, everyone. My name is Traifina Dongwana. I'm from Botswana, from a publication called Weekend Post. I've got 20 years in the media industry. I started Weekend Post in 2011. So far, it's 14 years in the industry. I'm leading the organization. I'm also the deputy chair for Botswana Newspaper Association.
Wow.
thank
So
you.
you have all the newspapers in that. Is it a group of newspapers?
It's a group of newspapers, but I own the one that is called the Weekend Post
Yes, of
newspaper.
course. That I
Yes.
am aware. But
Yeah.
you are connected to all other newspaper editors,
Yes.
etc. as well.
Yes.
So next time when we do the Botswana online health media training, you help us to reach out to other journalists so that they are also able to benefit from our training session.
Yes. Thank you.
Thank you.
Bonjour, je suis Raissa Silvana Oyaseko, je suis gabonaise, je suis directrice du journal Écho du Nord et j'appartiens à l'organisation patronale des médias, donc je suis la vice-présidente. Je suis si honorée d'être ici parmi vous parce que toutes les questions que vous avez abordées aujourd'hui me concernent directement. J'ai été torturée, j'ai perdu mon enfant et aujourd'hui je lutte contre l'infertilité. Donc, c'était vraiment des questions très sensibles pour moi. Je vous remercie.
Thank you so much. Correct me if I'm wrong. You are the president of Gabonese Journalists Association. Are you the president of the Gabonese Journalists Association?
Je suis la vice-présidente de l'organisation patronale
Wow.
des médias.
Wow. Great. Great, great. So many new things are coming out now.
Pardon.
Okay, my friend
Merci.
Cassian. Yeah.
Yes, I come from a French country. I will speak in French. Je m'appelle Cassien Aoungane. Je viens de la République démocratique du Congo. Je suis journaliste. J'ai autour de 15 ans d'expérience en journalisme. Je travaille dans le domaine de la diplomatie et du développement. Des questions. Je travaille dans les sujets relatifs à la diplomatie et au développement. Et aussi les sujets de santé. Donc, je travaille aussi dans un organe de médias qui s'appelle meolis.net. J'ai également un blog qui s'appelle Diplomatie et Développement. Je traite aussi les questions de santé et j'ai participé à beaucoup de compétitions de la Fondation Merck sur la sensibilisation. J'ai soumis beaucoup d'articles et j'ai gagné beaucoup de prix. J'ai beaucoup de médailles et des diplômes. Et yeah,
Great,
you can
great,
clap.
great. Let's clap for him. The reason he's winning every year is not because he's a friend. The reason he's winning is he's sending us like bulk entries and all amazing articles, very well researched, in-depth articles, spreading awareness. So that is why he's winning every year. So that is what I request from you all as well.
Donc, finalement, j'aimerais remercier la Fondation Merck pour tout ce qu'elle fait sur le terrain. Avec les luminaires, les Health Media Training, donc formation média sur la santé. Et je suis tout à fait disposé à continuer à travailler I wanted to say closely, étroitement avec la Fondation Merck. Merci.
Thank you, Cassian. Thank you.
Hello, everyone. My name is Khomoto Midupi. I'm from South Africa. I work for the Media 24 under News 24 and the Daily Sun. I have 11 years experience in journalism. I did radio. Right now we're doing online. We also did print, but it closed down last year due to the online taking over in our country. I covered range of news. Right now, currently, I'm focusing, or I've been placed to focus in politics, But I have also been given a chance to explore other aspects of news that I find interest, such as this one, health, and other, especially those that affect kids. I'm very passionate about kids, and that's where I believe I do best in. And I also, in my company, I also assist in training the younger journalists who come in with legal reporting and also how to report on children. Thank you.
Great, Kamotso.
Okay. My name is Vitus Audex. I'm a journalist from The Guardian Limited in Tanzania, Swahili-speaking country. The organization has two publications, Swahili and English publication, Nipashe and The Guardian. I am also the bureau chief of The Guardian Limited in the Lake Victoria region with the
Wow.
8 regions. Since I joined journalism, I near to approach 10 years now, but I'm specialized much on environmental journalism, children and the women. Yeah, that's all.
Thank you so much, Vitus. We were in your country last year for our luminary, and we had the conference in partnership with Her Excellency, the President of Tanzania. Did you come? Did you attend? It was in Dar es Salaam. You attended all because you were not in Dar es Salaam. Okay.
Hello, everyone. My name is Margaret Samlela Chisanga. I'm from Zambia. I work for a newspaper called the Zambia Daily Mail. It's our national newspaper. And there I'm the online editor. I've
Okay.
been working with Merck, I think, since they first came to Zambia. Yes, and from that time I've been following online. I've attended
Yeah,
most
and
of
it's
the
been
sessions online.
like I remember 6 years, exactly 6 years is when we first went to Zambia. And she has been associated with us since then. Thank you so much for coming, Samila.
Hello, everybody. My name is Alec Ponje. I work for the Times Group in Malawi. It's Malawi's largest private media company. We have a television, Times Radio, Times Press, which is the print section. We also have Times Online. I work as an assistant editor. I mostly focus when it comes to writing or producing stories. I mostly focus on environment, health, and agriculture issues. I'm also a filmmaker, so I do produce documentaries. I also host a couple of programs both on the radio and on the television. Thank you.
Thank you, Alec. And Alec is also has won our award recently, and you've won before as well, right, Alec? Yes. And Jesse, who's just about to speak now, has also been our winner multiple times.
Okay, good afternoon, everyone. My name is Jessie Ngoma from Zambia. Interestingly, I'm not a journalist. I'm a librarian. I worked in a media institution for about 22 years. But my passion for writing in social issues, health matters, and gender-based violence. I also write a column in one of the tabloids of Zambia, the Times of Zambia. I write a column, and I've been with Merck Foundation, I think, from about 2020. I think I've won 3 or 4 awards since 2020. Thank you.
What did you say?
Hello, good evening.
Good evening.
You can see me?
Yes, of course I can see you.
Okay. My name is Joanne Babas. I am a reporter. I work with the New Times.
The New Times, yes.
Yeah. In Rwanda. It's Rwanda's leading daily.
Topmost, I know, I'm aware.
Yes. So I've been working with the New Times for 8 years now.
8 years now? Okay.
Yes. So it's a pleasure to be here. We appreciate. And I'm glad to say that I recently won an award. I also did like my brother. I just sent in, I think in every category, I sent 10 stories. Surprisingly, I was chosen as the best. So I appreciate. So if it doesn't have a limit, I would love to do it every year.
it doesn't have any limit, number of stories each year you can apply. There are many of them because they won once year. They are like 1 year, they are applying every year and they're winning every year because of the quality of their stories. Also, the quantity matters in media awards, not for the fashion awards, music awards, song awards, but the quantity matters here. Why the quantity matters? Because the more you write about one issue, more you are raising awareness. So hence the quality and quantity both matters here.
Okay, let's keep
So if
writing
you have
then.
more stories, you have higher chances of winning. This is for everyone to note, please.
Thank you so much.
Joanne, you've joined us for the very first time, right?
Yes.
So please let's give her a hand and a round of applause.
Okay, so I'm Agnes Opoku from Ghana. Yes, I work with New Times Corporation, and our daily paper is called Ghanaian Times.
Yeah.
Yes, I've worked with Ghanaian Times over a decade, since 2009. And
2009?
Yes.
Oh.
And then I've won Merck Awards 3 times.
Yes,
that
yes,
is,
yes.
yeah.
Thank you so much, Agnes. Let's clap for her.
Bonjour, j'espère que vous allez bien. Alors, je suis Ambroisine Memende, je suis journaliste basée au Togo. Je dirige depuis 2010 une agence de presse qu'on appelle Savoir News. Savoir News a un site qui est proprement dit l'agence, qui est un média généraliste. Et un autre média qui est un site, un web magazine qu'on appelle Agroclimatique. Je m'intéresse aux questions liées à la santé et à l'environnement. Parce que ces deux questions ont une connexion avec la vie. Alors, je pense aussi que les médecins et les journalistes de son côté, mais vers la même cible.
Very, very well said.
Alors, le médecin détient l'information thématique et le journaliste se présente comme le vecteur le plus proche de la cible avec une bonne maîtrise du rendu, du rendu informationnel. Pour les aller à moi-même, j'ai été membre du Conseil national des patrons de presse du Togo de 2014 à 2018 et membre de l'Observatoire togolais des médias pendant 4 ans aussi.
Nice.
Les questions liées à la santé, à l'environnement et spécialement aux enfants sont des questions qui me préoccupent beaucoup. Et je fais une sensibilisation accrue sur les violences basées sur le genre, la mutilation génitale féminine au Togo. Mon histoire avec Merck Foundation date de 2021. Et grâce à mes publications, j'ai été lauréate jusque-là. Et les sensibilisations que je fais, à l'endroit de mes confrères ont fait au moins cette année, nous sommes 2 lauréats venus du Togo. Merci.
Thank you. Thank you, Ambrosine. Thank you, Ambrosine. Gloria, can you please take the mic?
Good evening. My name is Maki Mukhtar Jallo. I'm from Sierra Leone. And this is the first time I'm here with Merck Foundation. And I'm going to 5 years now since I joined the media, but with series of achievements, which I can say it beyond 5 years achievement. I won an award for the Merck Foundation this year. It's my first time to apply. and then I came second for print media in West Africa. And within a month, currently I'm the National Heroes Award in Sierra Leone. I won the Young Creative Journalist of the Year before coming here. So I want to make a promise to Merck. I've opened doors for journalists in Sierra Leone, and I promise you that in the next award, you will see application from Sierra Leonean journalists.
Great. That's a great commitment.
And I'll continue to apply because the president of the Sierra Leone Association of Journalists told me one thing the day they announced me as an award winner. He said I should put the country flag at first position because I came second, and I will apply it until I came first.
Yeah.
So thank you very much.
So you have to apply for the 2025 awards now. Yeah.
Good evening. My name is Gloria Milimu. I'm a health and science journalist from Nairobi, Kenya. I work for an organization known as Standard Media Group. Like I've mentioned, I'm a multimedia journalist, meaning I do stories for radio, TV, our digital platform, and also newspaper. Mostly health and science, though I also do other bits. And this should be my 8th year writing stories on health and science. And I'm glad our paths crossed, Mehak, because such forums they give us an opportunity to learn and also relearn. So it's always a pleasure being here.
So that you just said learn and relearn. I want to emphasize something here that some of you must be wondering that, we're touching upon the same topics year on year. Why are we not changing? It's very easy to change. But, for you, it's something that you're learning every year. But the communities there, they are not getting the message in an effective way. So it is important for us to keep talking about the same issue again and again and again till we make a difference. So just in case you're wondering, I thought I should clarify and tell you about why we do it. And we expect the same from you, to write about these important issues again and again and again. Hence the quality is also matter, and the quantity also matters.
So just to add on onto that, I run a weekly health segment known as Health Digest, where we highlight different health topics, also science, and I'm yet to win any Merck Foundation award.
You have to apply for that,
because I've never applied for any.
You have to apply for that. I've never seen an entry from you.
I know many people have talked about winning awards and all that, so I just thought I would mention. I haven't been applying like guys from Mauritius, so maybe I should start. I guess it's based on my interaction with my seniors.
No, you have to
who
apply.
believe that health reporting is a calling, and you owe it to the society. For me, I draw my satisfaction from helping that woman back at home understand fertility issues, that child back at home,
definitely, but
issues
little
to
bit
do
of
with
recognition
diabetes.
will only help.
Sure, that's what I'm saying. I'll start applying.
Yes, that's the spirit. Thank you.
Okay.
Thank you very much. My name is Leon Lidigu. I am from Nation Media Group in Nairobi, Kenya. As per our contract, we are just journalists. There's no specific platform. So we generate content for all platforms, TV, print, NTV Uganda, NTV, all
Kenya.
Nation Media platforms across the region. So this is my 12th year as a journalist. I usually say I have two homes. One is in India and another one is in Kenya, because that's where I studied and I was mentored and trained by very phenomenal people like Rubika Liakat and the rest. Yes, they taught me.
Nice.
So I really appreciate. In the last 12 years, I think I've won 6 global awards, 5 local, including 2 ICFJ awards. And this year, I'm the AMREF Global Health Award.
Great.
I won a few months ago. So it's very humbling. I also sit on the Africa Reach to End HIV board. That is an organization that was started by OFLAD on the sidelines of AU 3 years ago. I was appointed by the former First Lady of Namibia, Her Excellency Monica Gengos. Yeah. So I still work there. And as of last week, I became also a part-time lecturer teaching at the Kenya Medical Research Institute, teaching
Nice.
scientists how to communicate health.
Wow, that's amazing.
Which is very important for me personally. And because one thing I've learned with health, because for me, I studied global health journalism. So if you gave me an assignment to do a political story, I won't go even past the second paragraph. I don't know. I honestly don't know. I think in science.
So
or
you're the
something.
right person to be associated with us.
So I quickly learned that the more you tell these stories every year, they start getting to your fingertips. So as a journalist, you should not overlook that. You become an expert in a particular field. Because right now, if you told my editors, I want a story on HIV, I want a story on nutrition, I want a story, they will know who to send it. I also combine health and climate and the nexus in between. So I've covered COP26, 27, 28, 29, and 30, hopefully. So I think climate and health are basically twins. They're very much interconnected. So I lead our team coverage when it comes to COPs.
Thank you.
Yes.
Thank
And
you,
then
Leon.
finally, I just would love to appreciate all of you. I love meeting, networking, and may God bless you all in all your endeavors. Thank you.
Thank you, Leon. Oh, we've.
Okay.
But I would like once a journalist, always a journalist. So just say a few words and then we.
Well, I've been working in the media industry for 28 years.
Wow, senior most, I'll say.
Mid, yeah. And in the written press, radio, television. I'm also international correspondent for the French channel France 24, BFM TV, and TF1. I've been winning several awards, CNN African Journalist in 2016, and the local in Mauritius also. And since January, I've left I would say I love the profession because I'm still in my mind, in my heart,
Like I said,
journalist.
once a journalist, always a journalist. You've just taken a new role as
That's
well.
it.
You've added a
and,
new
and,
role.
And I think it's very important because now I'm closely working with children, the GBV issues, the infertility issues, and everything that I've been working with Merck since 7 years now. And I think this is helping me really in my day-to-day job as a senior advisor at the Ministry of Gender Equality.
Great. Yeah. Adam is also a journalist. He was our moderator and MC for today and yesterday,
That's
but he's
right.
also a journalist.
I am Eminent Chotomi. I am online editor for state newspaper Ghanaian Times and The Spectator in Ghana. And I've been practicing for over 10 years. And I'm also a radio and TV entertainment pundit and an artist manager, as well as a PR professional. Thank you.
Wow. It goes on and on and on. Yeah. Thank you, everyone. We learned like many new things about each one of you. I would like to thank my colleagues Linda, who did beautiful moderation today, my friend Prashant, and also Anita, Ishan, and Vikas. And I would not forget my colleagues, very dear colleagues, Harsh and Alicia. Most of you would know them. They are not here, but they are very actively working here with us from India, managing Zoom and everything for us. So Alicia and Harsh, if you're watching, it's hello to both of you.
And thank you very much for joining us. Keep the good work up and keep working very closely with us. And because it's not that, you know, we're working on some very, very important issues, and that is where we need your support to break the stigma of infertility, to speak about the importance of girl education, to speak about women empowerment, to break you know, the cycle of violence, gender based violence, to stop FGM. These are some very important issues. And also diabetes and hypertension, raising awareness about these issues are like is very important right now, because you know, the data indicates that more and more people are facing these diseases now, and just healthy lifestyle and some dietary modifications can basically protect them. So if you talk about it, they will learn and they will adapt a good lifestyle. So thank you everyone, thanks a lot. Thank you for our panelists as well. Okay, two important things that are left now. We have your certificates here. We would want you to take it. But before that, let's gather here for a group picture. All of us should have a group picture. Vikas, Ishan, please join us. Anita, come. I didn't mention.